Ma'am, now look up. Now you are looking beautiful. देखा बगल बगल में बैठोगे अपने रिस्क है मास्क पहन लो इम्यूनाइजेशन किया अभी अभी क्यों पंगे ले रही हो हाँ मगर
Still, I don't have the courage to go for immunization.
Why? I will say go for 2 masks.
Because people are becoming sick now after first dose of
Take rest after that.
It's not necessary.
But then,
immunization
for vaccination, there was an article which said before vaccination, 48 hours before vaccination, at least you should sleep properly.
Sleep
No,
properly and
every
eat
time I
properly.
have some kind of sore throat. Yesterday night also I took cetirizine and paracetamol.
You take steam inhalation, no? Don't rely more on medication.
मैं खींच लूंगी बैठ जाओ ना
हम लोग
बाल सुंदर है अच्छा सुनो मैं थोड़े काटने की जरूरत हो रही है मुड़ रहे
वो ना बीमार हो गया मेरा नहीं
मैं क्वेश्चन एंड आंसर का टाइम नहीं है ना स्पीकर के बाद
थोड़े देर
So with this only it is better, no? वो प्रोग्राम शेड्यूल का एक कॉपी चाहिए.
वो तो नहीं आएंगे ना
नहीं
Because I have to introduce at least one word welcome to the speaker.
so I will not encourage so many
So here also without mask you take. Photo na.
No, my face is not looking pretty. I don't
मुझे
think
ये कि
Oh, you look pretty.
बोला या नहीं
No, you are looking very pretty. Take.
with this aging face, I don't like.
Take anyway. No, nobody can stop aging.
इसे भी चल रहा है.
सारे रिकॉर्डेड है एक ही लाइन अतुल का मिस्टर डॉक्टर अतुल का तब तो क्वेश्चन आंसर का क्यों क्वेश्चन दे रहा टाइम देंगे
मास्क पहन के अच्छी लगती है थोड़ा सा.
अरे कुछ नहीं होता गेट यूज्ड टू दिस स्टाइल नाउ
I know like. इतने पास लगा मोटी लूँ.
अरे नहीं लेके आ रही मोटी मैं आपको ट्रस्ट मी एंड माय फोन
फोन तो ट्रस्ट है.
मेरे पे नहीं है।
आधे को नहीं है.
हाउ चीप
साड़ी अच्छी
देखो मैम she trusts my phone doesn't trust me
I will not enter into your quarrels. This LKG, UKG quarrels you have to settle yourself.
अच्छा big ones you will enter no
No, for nothing. Because I am in pre-KG. I cannot solve LKG, UKG.
ये चलो साथ साथ लेते हैं
मैम एक फोटो.
मैम एक फोटो मास्क हटा लो
That we will sit close by. No distance. Social distance बाद में.
फोटो के बाद चलो जल्दी से ताकि
चश्मा नहीं चमक रहा मेरा. रुक जा मैं उतार दूँ चश्मा.
यार मेरा
OMG
ऊपर वाला पूरा वो
थैंक यू.
ठीक है.
अभी लो
So I should put you in media committee. Nah. Registration come media. I will make a committee.
I will do whatever
Yeah.
whatever needed and whatever
So whoever has given the messages, director, dean, MS, CNO, बस है ना? Only 4 ना?
मैम डीन मेडिकल सुपरिटेंडेंट फॉर्मर डॉक्टर संजय.
Okay. CNO. Okay.
इधर आओ देख लो ना मैं दिखा देता हूँ.
Ma'am, I just said 4-5 lines and then I'll invite you for welcome address. Then we will play Dr. Guleria's.
Hello, Rimple? Yes, Rimple.
देवाशीष का रिकॉर्डेड है. सुनो रिकॉर्डेड इसका देख लो.
Partly here, partly there. 3, 6. That's what I was thinking morning when I was coming. Around, including 6 people, around 12 of us are here now. So partly you can send here, partly is there. Na? Okay.
दूसरी वाली सिंपल में जानते हो के साथ जाएगा ये वाली तो हमारी स्टूडेंट है मैं नहीं जानती
मैं ज़्यादा दोस्त नहीं मुझे आंखें नहीं आ रही हैं.
जो आपकी
You told me that these are live. This one is live, this one is live. I have distributed the people who will introduce them.
Atul also live.
हमारा सेम प्रिंट है क्या? प्रिंट
3 are live. No?
So I have distributed them this people who will introduce them. They have made slides. They will project those slides and. सुनो मिलन, मैंने डॉक्टर वो नंदिनी को वो करना है इंट्रोड्यूस, तो उसका स्लाइड प्ले कर देना. कौन प्ले करेगा स्लाइड? हम करेंगे. व्हेन आई स्टार्ट ना डॉक्टर बोलेगी और मैडम को तो करने की जरूरत नहीं है, उनका नंदिनी बिकॉज़ शी कंट्रोलिंग होती है उनका कुछ आई विल स्पीक. ओके
सारी स्लाइड्स है ना मैडम?
आपको क्लोज अप चाहिए ना?
मेरी शक्ल अच्छी नहीं आती आजकल. आई एम नॉट हैप्पी विद माय फेस. करो
अरे एंड हुआ सर, कुछ नहीं होगा.
So only 4 more minutes are there. Dr. Sashi, you can also come and sit here. Come. No, 3 people it will look nice. Come. 3, it should be odd numbers, 3 or 5. 2 more also can join. Gopi, come no. Come. Why?
मैम रेडी.
Only 4 more minutes are there. You can check at 10:30.
ऐसे अच्छा है, पीछे का बात.
ठीक है.
Why you have palpitation? What is? You feel something bad? No, nothing. किधर?
मैम एक मिनट मैम.
साइकिलिंग करते हो.
राइट की तरफ आप
कंप्यूटर की तरफ.
और गोपी सर करते हैं.
गोपी सर पास में आओ.
We will arrange you.
थोड़ा सा ग्रुप में कह दिया.
थैंक यू. वेरी नाइस.
ग्रुप में बोल दिया.
प्लीज कीप योर फोन ऑन साइलेंट मोड.
Oh, Milan, you could not change the lower one.
Ma'am, this is not editable.
Okay.
This system.
Okay.
I will do it later, ma'am.
No problem. No need for later. Purpose will be over. No problem. We didn't have International Nurses Day.
No, 3 स्पीकर था ना, 3 की जगह छोड़ो.
Oh, International Nurses Day is down.
97 से सर्विस.
इसलिए ना मैं ट्रस्ट से निकाल रही है. अगर वो टेस्ट भी करनी है
3 जगह छोड़ता हूँ. 95 से कर लेता हूँ.
इसका ही कर दें.
Even says my
You
You can see the wrinkles of the eye.
हम तो यहाँ से भेज रहे हैं.
आपके बहुत अच्छा लाइट है, आप लोग के ऊपर लाइट नहीं है.
There is a problem in this place because
हाँ
of
एकदम
this light.
चमक रहे हैं.
Because of this light.
इसको बंद कर दो.
मैं प्ले करूंगी.
सर उधर से ले लेके आ जाएगी.
International Nurses Day, which is celebrated every year on 12th of May, on the occasion of the birth anniversary of Florence Nightingale, the founder of modern nursing. On International Nurses Day, we, the nurses, are acknowledged for the compassion, professionalism, and the round-the-clock commitment of nurses for patients under our care. The commendable services rendered by nurses, especially during these challenging times of pandemic, witnessed all across the world, has been exemplary. Video also keep it on. A very good morning to all of you. On the occasion of International Nurses Day, which is celebrated each year all around the world on 12th May, on the occasion of the birth anniversary of Florence Nightingale, the founder of modern nursing, on International Nurses Day, we the nurses are acknowledged for the compassion, professionalism, round-the-clock commitment for caring for the patients under our care all across the world. The commendable services rendered by nurses, especially during these challenging times of pandemic, which has been witnessed all over the world, has been exemplary. The theme for 2021 for the Nurses Day is Nurses, a Voice to Lead, a Vision for Future Healthcare. In 2021, we seek to show that nurses will look into the future as well as how profession will transform to the next stage of healthcare. We welcome you all for the webinar which has been organized by College of Nursing AIIMS Delhi on the theme Nurses, a Voice to Lead, a Vision for Future Healthcare. We will begin with the welcome address by Dr. Lata Venkateshan, Professor cum Principal of College of Nursing AIIMS Delhi, a dynamic leader and a great visionary with exceptional contributions towards the growth of the profession. Dr. Lata Venkateshan, please.
My dear nurses, wishing all of you a unique and safe International Nurses Day. And I am really pleased to welcome all of you for this webinar organized by College of Nursing AIIMS on the theme of International Nurses Day. Hands that turn caring into action, touch that turns compassion into comfort, smiles that turn love into healing. Yes, during these trying times of COVID, nurses have proven that they are strong enough to handle the toughest situation and soft enough to understand the emotions of the patients and families who are undergoing the crisis. Leaving behind their own families, the selfless services of nurses are receiving worldwide recognition and appreciation from every corner of this world. The policymakers and the public have understood the contributions and the challenges faced by nurses and are willing to extend their support in multiple ways. This is the right time or year to use our united voice to lead the profession. Yes, the theme of this year's Nurses Day is rightly chosen, Nurses, a Voice to Lead, Vision for Future Healthcare. Nursing is an evergreen profession. The unraveled paths are still many, and nurses are an integral part of every family from birth to death. Vision for future need to include how to groom next generation nurses as leaders and ways to promote patient satisfaction, grow along with healthcare expansion, showcase our contribution in bringing down the worst healthcare indices, methods to give independent and care and gain public recognition, newer specialties, breaking the stereotypes in nursing, and much more. Yes, so this is the theme and the topics chosen by us to be addressed by well-known curated speakers from across the country. So if you can speak, you can influence. If you can influence, you can change lives. So let us see today's webinars, how it will give us a voice to speak, influence, and change the lives of people. when you're surrounded by people who support you, you achieve your success quickly. So we are extremely thankful to Director of AIIMS, Dr. Randeep Giloria, who has accepted to inaugurate this webinar and always supports nurses and all the activities which are related to nursing. We welcome you, sir. We also welcome the Dean of AIIMS, Medical Superintendent, Chief Nursing Officer, and the former faculty members and the principal in charge of College of Nursing, who have sent their messages and wishes to all the nurses in AIIMS and across the country for the International Nurses Day. The speakers of today are known to many people in the country. Dr. Nandini Subbaiah, the professor of National Institute of Health and Family Welfare, is here to unfold the theme of the International Nurses Day. Nurses play a vital role in leading the quality healthcare in every setting where healthcare is given to the people. And we have Dr. Atul M. Kochar, the CEO of National Accreditation Board for Hospitals, who is going to address about how nurses can be a voice in leading the quality healthcare for our country. And we have Dr. Pramod, the Executive Director of Translational Health Institute in Delhi. He is here to talk how nurses can be a part of the translational health research. And I'm sure the association with Dr. Pramod will open ways for nurses to engage into translational health research. And we also have Dr. Pavan Kumar Gupta, who will talk about digital education system, which is need of the hour during the pandemic, where the education is happening only through online. The college and school gates are closed, but the learning is happening only online. And he was part of the committee which was framing the national education policy for the entire country. After 34 years, the national education policy is being revised and getting formed. And he is here to enlighten us about the national education policy and its implication for nursing education. And of course, we do all these things to gain the patient satisfaction. If the patients are satisfied, we achieve the success of nursing care. So how to understand the behavior of patients as consumers and to promote their satisfaction, we have Dr. Devashish Das Gupta, the professor from Indian Institute of Management, Lucknow, to help us to understand the behavior and promote the patient satisfaction. And of course, we have our own resource person from AIIMS, Dr. Shantanu Ganguly, the Chief Librarian, who will talk about the Digital Health Connect and how can we grow in the sector of nursing informatics. So my wholehearted welcome to all the speakers and my sincere thanks for accepting to address the nurses on this special day of International Nurses Day. This program is dedicated to all our faculty members from AIIMS who has put all the bits and pieces together and made this program to get organized successfully. So my wholehearted thanks to the entire faculty team who has supported to implement this webinar on International Nurses Day. And I welcome all the delegates and participants who believe in us, who believe in the information which is disseminated through the webinars organized by College of Nursing. I welcome all of you and continue to support in future by joining us for all the educational activities we organize. And I thank Almighty God for giving us the wisdom to organize this program and to get connected with the well-known speakers who have agreed to speak and support us. Thank you all and enjoy the whole day of webinar and all the sessions. Thank you so much.
Thank you so much, ma'am, for those inspirational words and your blessings and good wishes. It will go a long way in us celebrating this day, and hope the webinar is going to be fruitful and you're going to gain a lot from it. I have an announcement to make. We are really moved by the overwhelming response from the participants. Since we have reach the full capacity of Google platform, I will request all of you to join on our YouTube link. So kindly join on the YouTube link which has been shared by us. Now we will have the chief guest address. Padam Shri Professor Randeep Guleria, our Honorable Director, requires no introduction. He is a legend with infinite laurels, an excellent physician and a great leader, a very well-known personality nationally and internationally. We have a recorded message which we are going to play for you. Professor Randeep Guleria.
They celebrated every year on the 12th of May. It marks the birth anniversary of Florence Nightingale. The lady in the lamp who really set an example of how nursing should be in trying times, especially during the war that she had faced at that point in time. The International Council of Nurses marks this important day by having a number of seminars and educational activities and releasing things to social media. This is truly a very important day for the nurses community. The theme for 2021 has been nurses, a voice to lead, a vision for future generations. I think this is a very, very important theme because it really puts nurses where they should be as leaders and also looking at the future of health. We are actually going through a trying time as far as the pandemic is concerned. COVID-19 has affected all of us. Many people have lost lives, and we have seen many families get disrupted because of the loss of the near and dear ones. In such trying times, healthcare workers, especially in the nursing community, have really come forward and really work beyond the hours of duty to help those who really need care, suffering, general patients. And I think this is what nursing is all about, to go beyond the 50 hours, to really be willing to work for the betterment of mankind. And because of this, I think nurses should be involved in a lot of decision making, a lot of policy making, because they understand the suffering and the care that is required in the There's also a need to really incorporate nurses aggressively in day-to-day management strategies. And therefore, I think there is a need for doing two things. One is to really get technology into nurses training, so that nurses are well trained in how to use technology in today's time. And that is why the vision for future healthcare becomes important. Because as we move forward, technological advances will become very, very important as far as healthcare is concerned. The second important thing as far as nurses is concerned is that they need to be involved very much in terms of becoming more and more specialists. Specialty training for nurses, whether it be in the ICU, whether it be in operation theatre, whether it be in public health, or whether it be in critical care, is becoming more and more important. Sometimes nurses are able to really understand and take action even before doctors reach the patient. And that is why it's very important that we develop specialty courses for nurses in our country, so that they are stand hand to hand next to the doctors in trying to provide quality care for our patients with empathy, with feeling, and with that desire to really serve and go beyond the call of duty. Today, I would like to really congratulate and wish all the best to the entire nursing community. They have really struggled and worked very hard during this year and during last year. And I wish them all the best. Stay safe, stay healthy. Thank you very much.
Thank you, sir, for those enlightening words of encouragement and acknowledging the contribution of all across the world, especially during these trying times of pandemic. On this International Nurses Day, we have greetings and good wishes from eminent leaders and administrators. We'll be running those messages which have been sent by the Dean, Dr. Anita Saxena, our CNO, Mrs. Kamlesh Chandelia, our former Principal College of Nursing, Dr. Sandhya Gupta, and our medical superintendent, Dr. D.K. Sharma. So we will be running those messages for you.
I wish to congratulate all nurses at the All India Institute of Medical Sciences or anywhere in India or all around the world on this International Nurses Day. As we all know, this day is celebrated on the 12th of May every year since I think 1965. And 12th of May happens to be the first anniversary of the modern nursing founder, the great Florence Nightingale, whom we also call Lady with the Lamp. Each year, nurses celebrate this day to bring public awareness about nursing and also to contribute towards better healthcare innovations. International Nursing Day kits are actually distributed on this particular day, which have material for education and public information. This day also has different themes, and this year's theme is a voice to lead, a vision for future healthcare. I would say this is a very good theme in the current pandemic that we are going through, where nurses are playing a very, very important role in the health system. As we all know, nurses are the first and the fastest contact point for health services. And we celebrate their hard work, contribution of the nurses to the health system on this International Nurses Day. Although all healthcare professions are very, very important, but I think nursing profession is the most noble of all healthcare professions that we know of. And it requires a very special kind of skill to be inculcated in the people who want to take nursing as their profession. So nurses are expected to be very, very understanding, very helpful, should be very strong but sweet, taking care of patients with love, empathy and dedication. In fact, nurses are like angels who watch over health and bring relief and happiness to the patients. Their responsibilities are multifaceted. I don't know any other healthcare profession where so much responsibility are given to that particular person. Here, nurses are not only responsible for patients' care, patients' comfort, patients' hygiene, but also assisting evaluation of diagnostic tests, setting up IV drips, giving the blood transfusions, giving injections or oral drugs, also checking that they are giving the right dose, and also maintaining patients' records. They have to be very meticulously maintaining patients' records because a lot of data that the doctors and other healthcare professionals look at is what has this happened in blood pressure or vitals or any other information. In addition to all this, they have also to mentor the junior nurses, organize the staff, the rosters, and so on. And they are also expected to educate and reassure patients and their relatives, and sometimes in the event of sad or tragic incidents like death of a patient, they are also there to comfort the patients and the families of these who lost their lives. So all in all, I would say that they are really making a great contribution to the healthcare system of any country, not just India. And in addition, they also have to keep up with the ever-changing processes and continuous advances that happen in the healthcare, especially when they're taking care of patients in the ICUs or in very complex situations. They not only have to meet the patient, they also have to meet the hospital management. Especially, as I said, they are working in very, very stressful environments. So I think each day for them is very demanding, erratic, mentally and emotionally draining for them, and may actually lead on to stress and burnout, as I can see in these conditions that they are working in right now. So I think it's very important for the rest of the medical fraternity, the healthcare system, to collaborate with their nurses and work with them very, very closely and in a very, very positive manner, so that there is no frustration that may creep in the nursing profession. This is the time for the nurses to lead, innovate for the future, and I think this is what they have for the year 2021. However, whatever they do, the focus has to remain on improving the healthcare system and improving patient care. So again, I congratulate you all on this day. Wish you a lot of happiness on International Nurses Day. Thank you. Good morning, my nursing colleagues. I am indeed very happy and pleased to be here amongst you virtually on the August occasion of celebration of International Nurses Day 2021. I would like to compliment and congratulate you all on this occasion of International Nurses Day being celebrated around the world every year on 12th May, which happens to be Florence Nightingale's birthday. We are all aware that the theme for 2021 International Nurses Day is nurses provide to lead a vision of future healthcare, which is very apt considering the role of nursing in patient care services. I need not overemphasize the relevance and importance of nursing staff in ensuring smooth delivery of patient care services in any healthcare organization, starting from PHC level or home care up to a premier tertiary care medical institute like all medical sciences. I do not have any hesitation to put up on record that the patient care is primarily nursing, and the nursing staff have a significant role in early and complete recovery of the patient physically as well as psychologically. I am well aware that nursing staff everywhere, be in AIIMS, be in a medical college, be in district hospital, in primary care level, or for home care setting, have always been in the forefront to provide best care to the patients with empathy, passion, and compassion. In a hospital, different people have varied expectations from the nursing staff. The patients look to her for comfort. The patient's attendant for reassurance. The students for training nurses for guidance. And the junior doctor for help in learning various procedures. And so far as the faculty or consultant is concerned, he is as lost in the ward without a nurse as a ship is lost in the sea without a compass. Because it is a nurse who is aware of and informed about every aspect of patient care. Expectations of doctors from the nursing staff are enormous. She has to be everywhere at the same time. She has to accompany the doctor for the rounds, help him examine the patients, tell him about the physical condition and the progress of the patients, carry out orders speedily, and stand quietly by his side while he examines the patient. Not surprisingly, the patient wants to know from the sister about what the doctor has said. She is obviously more trustworthy, more gentle, and more understanding. She is a true friend of the patient. She is looked upon like a mother, like a friend, a secretary, a technician, all rolled into one. She has to be agile, yet patient, and gentle, yet firm, all at the same time. Even after strenuous hours of duty and myriad responsibilities, she still has the energy to organize various functions like celebrating International Nurses Day, which is happening on May 12th. No wonder that nurses are an icon of selflessness, fulfilling everyone's patience, and they are a bundle of joy for everyone who comes in contact with them. They are the unsung heroes who bring life into the world, care for the patients unconditionally, who are sick and injured, and unfortunately, sometimes they have to watch the patients pass away whom they had nursed very lovingly. On this International Nurses Day, let us acknowledge the hard work, long shift hours, and emotional pressures that they go through in their daily routine. Kudos, and all the very best to my nursing colleagues. Thank you.
I welcome you all. As the country braves a deadly pandemic, we cannot even attempt to appreciate the effort of the health workers, especially nurses, who are working day in and day out to help the patients. To celebrate the International Nurses Day, you can share Happy Nurses Day to all the nurses around the world. You all are our heroes and angels, our actual superstars. As a nurse, we have the opportunity to be the heart, mind, soul, and body of our patients and their relatives and ourselves. They may forget your name, but they will never forget how you made them feel. Celebrations of International Nurses Day denotes that as much as doctors play an important role in saving a patient, nurse is equally important. That is to take care of the person's treatment. Besides giving medicines, they keep up the patient's spirits and providing hope. Some nurses play a role as good as family members. This day is celebrated to mark the importance, honor their roles, and make healthcare meaningful and effective in their 24/7 job. Nurses bear the true spirit of humanity. Happy Nurses Day 2021 to all the beautiful souls. Thank you so much for bringing hope into this fear-stricken world and giving nursing sick and their family with your love and care. Happy Nurses Day. Thank you.
Very good morning all. My regards and wishes to one and all on this occasion of International Nurses Day 2021. The theme for this year's International Nurses Day 2021 is Nurses, a voice to lead a vision for future healthcare. In 2021, we seeking to show how nurses will look into the future as well, how the profession will transform the next stage of healthcare. As we all know, nurses are fundamental to the provision of safe, accessible, and affordable care. Moreover, the past many months, nurses exposed to COVID-19 infected patients have kept a distance from their families and they face lots of challenges because of this pandemic. COVID-19 infections, death among nurses and other healthcare workers, stress and burnout in our own profession, nurses shortage and retention, and so many other things. 2020 to 21 is an important time for nursing. It provides the opportunity to clearly demonstrate to policy makers, health professionals, and the public about the contribution of nurses to health and well-being, the roles and responsibility of this vital profession. COVID-19 has changed our lives, deeply affecting those who have been infected and those who have lost loved ones as a result of this devastating virus. The pandemic greatly impacted the lives of nurses and the health system they serve. Although daily life may have changed, the core character of nursing has not. Now more than ever, health, economics, and society are heavily influenced by nurses who are on the front line battling COVID-19 while continuing to improving access to quality and affordable healthcare. I would like to say here that it is a start, not an end. It is the opportunity to begin a new chapter, but it is not our destination. We are an indispensable and unstoppable force, and together we can we will. Thus the word to health. On this International Nurses Day, Nurses show they continue to wage a war against COVID-19 pandemic, a great sacrifice. I wish on this day the unrecognized roles of nurses and midwives, especially their tireless contribution in mitigating COVID-19 pandemic to lead the recognized, respected and duly acknowledged as their origin or working keeps on expanding their capacity and skills need to regularly updated and provide with comparable incentives. Thank you.
I would like to thank all the speakers, Dr. Anita Saxena, Dean, All India Institute of Medical Sciences, Dr. D.K. Sharma, our Medical Superintendent of AIIMS Delhi, Dr. Sandhya Gupta, our former Principal, and Ms. Kamlesh Chandelia, the Chief Nursing Officer of AIIMS Delhi, for your greetings and acknowledging the contribution of nurses in the healthcare system. Now we will move to the unfolding of theme. It is my proud privilege and pleasure to introduce Dr. Nandini Subbiah. Dr. Nandini Subbiah is a professor at the National Institute of Health and Family Welfare.
Hello.
Yeah.
Good morning, one and all. Respected dignitaries, my dear friends and students, at the outset, I wish you all a happy Nurses Day. I am grateful to the organizer, Professor Lata and her team for giving me this opportunity of unfolding this year's theme of International Nurses Day. As you all know, every year Nurses Day is celebrated on World Day, the birth anniversary of Florence Nightingale, the founder of modern nursing, who has laid benchmark for the nursing practice. This year, the Nurses Day theme, as it was mentioned by my previous speakers, nurses, a voice to lead, a vision for future healthcare.
She's talking.
This year's theme, I will request Dr. Lata to ask someone to show my slides.
Yes, madam.
Or I will do it myself. Please give me a second.
Yeah. Wait.
Are you able to see the slide?
No, madam.
Yes, ma'am. Yes, ma'am.
Okay. You're able to see?
We are not able to see.
No, we are not logged in.
The CS team highlights that the nursing is the most versatile occupation in the healthcare workforce, and nurses are crucial to the delivery of healthcare. With every passing decade, no doubt, the nursing has become an increasingly integral part of healthcare service. It is impossible to imagine a future without a large number of nurses in the healthcare delivery system. As Madam Lata has mentioned that nursing is a evergreen profession. It's a noble profession. We nurses are the blessed professionals who have been chosen by the God to serve the mankind. But at the same time, we also have to remember that it is highly demanding profession. I'm sure you all will agree with me, whether it is war or peace, whether it is a pandemic or not, this noble work goes on continuously forever. As Madam Sanjay Gupta has mentioned, that nursing has the chance to touch people's lives. Yes, the nurse is all the time present in the service of the sick. This has not been highlighted better than the COVID-19 situation, when the entire country is in a lockdown and over a billion of people stay at home to minimize the transmission of COVID-19. Our nurses are reporting at work every day to care for the sick, even when their lives are at risk. Even the patient's relatives, even the patient's family members are not able to take care of their unable family members. But our nurses are there to provide care tirelessly day in and day out for the welfare of the patient. As Madam Anita just now mentioned that nurses are often the first healthcare provider that patients need. You may take any level of healthcare facility. It may be primary level or the tertiary level like Indian Institute of Medical Science, New Delhi. Nurses are often the first healthcare provider when the patient goes to the hospital. Patients meet the nurse for the first.
Madam, sorry to interfere.
Care to the sick at all hours of day and night with patience, empathy and sensitivity. It is the nurse who knows and understands all the details that are required for administering the care, not to the patient.
Dr. Nandini, 1 second. Your slides are not visible. Yeah.
Is it visible now?
Yeah, now it is visible. Yes.
Yes, ma'am. Are you able to see the slides now?
Yes, we are able to see now.
Yes, ma'am.
Switch on the mic.
Yes, ma'am.
It does not work from here. From that mic.
It is we can see the slides now.
It is the nurse who knows and understands all the details that are required for providing patient care. They have no insight into patient care since they spend much of their time with patients. They act as a liaison between patient and doctors and also with others in the health facility. They have a macro view of the healthcare system. It is not an exaggeration if I mention that in any healthcare facility, the patient outcome is predominantly determined by the care provided by the nurses. So now, due to advancement in healthcare technology, there is vast change, there is a vast transformation in the healthcare delivery system. What we learned 25 years back has become obsolete today. And what we learn today may be after few years. So the nurses need to be open for learning and they should be the leader for change. They need to be the providers, patient-centered care. They need to be proficient in terms of competency to deliver comprehensive healthcare services in an effective, efficient, acceptable and affordable manner. You all will agree with me that our primary nurses, our primary goal is to provide optimal patient care on the basis of evidence. From where do we get this evidence? This evidence we obtain through research. So nurses nowadays are involved in undertaking many research studies to find evidence to support new nursing interventions. The evidences help the nurses to make sound decision and judgment in the patient care. It is cost effective and it also results in positive outcome of the patient. And the important role of a nurse during this transform the healthcare delivery system is that she should be flexible and she should be able to adapt to the new technology. She should be open to learn. And they also need to adopt the innovation in the healthcare services and delivery system. I would like to mention here recently we had a bond for vital assistance to one of the hospitals in Delhi. That we could see that during this COVID-19 period in that particular hospital, they adopted a good innovative model for the pulmonary function test, even infection. And when they do testing for COVID-19 patients again, this was very simple, it was very cost effective, but still our nurses have done that innovation model along with the other healthcare team. And it is also important during this transform healthcare development that our nurses should learn as a team along with the doctor and the other healthcare professionals. Collaboration is very much important to achieve success in our healthcare. So we have many innovation in nursing, we have various technology, we have evidence-based nursing practice, whatever nursing intervention we perform, that is based on the evidence. For getting that evidence, we are involved more and more in the research studies. Our nurses are doing postgraduate studies. They are doing studies in the area, not only in the clinical area, but also in the community, and they bring many evidences based on which many nursing interventions are implemented. And nurses are also the entrepreneurs. And we started maintaining electronic health record in the healthcare facility. And nurses are function as a consultant. And even now, we can see many patients, we have robotic nursing, and the nursing administration is cost-effective. So if we have to achieve the innovation, or to have a vision for our future, what we need to do? The first and foremost thing is that strategic healthcare planning. The COVID-19 pandemic, wave 1 and now wave 2 has clear message for nursing administrators and planners. It has conveyed the importance of preparedness, that is the availability, ensuring the availability of adequate nurses to meet health emergency. It is not only bringing up the vacancy, but also having to swing to action. This is the need of the hour. So, as a nurse administrator, or as a nurse who is involved in policy planning, or the nurse who is involved in policy implementation, it is very important for the nurses to be involved in strategic workforce planning. Then we also at the same time we also have to ensure the safety of the nurses. Now the internet, you all might have seen the fact sheet which has been published by the International Council of Nurses for the year 2021 during this nurses graduation. It has mentioned that about 1.6 million healthcare providers have been infected by COVID-19. This data is only up to December 2020. Now I'm sure the number might have gone very high. And now even in our WhatsApp group messages, we are seeing how our nurses now have been affected by COVID. So it is for most importance when we are providing care to the patient, we also need to ensure the safety of the nurses. And nurses should practice to the full extent of their education and training And as the director, sir, Dr. Guleria has mentioned that they need to be involved in specialization and they need to be, it's the right time to focus on the quality of education. The nurses should be involved in higher education and so that we'll be able to provide good quality, high quality nursing education. And nurses should know how to work with the doctors and other healthcare professionals as a team. And we should also expand the opportunity for nurses to lead and to provide services in a collaborative manner. And it is the need of the hour to implement nurse residency program. And as we all know, lifelong learning is important because what we have learned earlier. Now, for example, I will tell you, I learned 25 years back. What I have learned 25 years back is not matching with the current scenario. So unless otherwise I keep updating myself with the current technology in the healthcare facility, I will not be able to provide good education. I will not be able to provide good practice nursing services to the patient. So that it is very much important that nurses should be involved in continuous education program and they should learn lifelong. And they should also get an opportunity to be changed, and they should get an opportunity to be the leader, to develop their skill to be the leader. And they also, it is high time to focus on the quality education. Now let's see what are the varied role of nurses. We have frontline healthcare workforce, infection control nurse, we have in the health facility, we have nurse anesthetist, clinical nurse specialist, forensic nursing, informatic nursing specialist, hospice nurse, tele-nurse, nurse researcher. All these are different role of nurses we see in Western countries. And now in India also we have started having our nurse practitioner in midwifery course. And there are many other specialized nurses, nursing role has started coming up. And in the community also, to achieve universal health coverage with AIIMS Bharat mission, the demand of healthcare services and the healthcare worker with appropriate skill has increased. So nurses are appointed as community health officer in the health and wellness center to provide comprehensive healthcare services, and they are working at all the levels. And this healthcare providers, this community health officers are appointed in the sub-center level, that is health and wellness center, and they will be providing comprehensive healthcare services which include preventive, promotive, curative, rehabilitative services. They will also be going for home visits. So for carrying out all these things, we need the full support from everyone, starting from the administration, starting from the management, and also from the other healthcare providers. But we also have many barriers to provide high quality care. For example, I'll tell you now, during this COVID situation, nurses are exposed to large number of patients in long shift with inadequate rest period that causes exhaustion and mental stress amongst them. And they have the ICN report has mentioned that during this year 2020, as per the recent survey done by the ICN, 20% of National Nurses Association have reported increased rate of nurses leaving the profession because of mental tension, because of the exhaustion they have. So they need support from everyone. And COVID-19 infection and death among nurses is another great barrier. We have lack of administrative support, we have limited resources, we have restrictions on the scope of practice as an advanced practice registered nurse. We have many workplace hazards. We have lot of turnover in the nursing profession, And more than anything, nurses have lack of confidence also sometimes not tackling the patients. So in the conclusion, I would like to say that the nurses' contribution to achieve universal health coverage and the sustainable development goal is extremely important. Their contribution is very much crucial, and nurses have the power to transform the healthcare system to provide acceptable, affordable, high quality care which is patient centered. Thank you so much.
Thank you, Dr. Nandini. We like to thank you for highlighting the multiple and multifaceted role of the nurses, which form the backbone of any healthcare system or anywhere across the world. And thank you for focusing the innovation and very holistically unfolding the theme. We really are very grateful for you for spending your time. Thank you, Dr. Nandini. I would like to make an announcement. There are many people saying they are unable to join. Since we have reached our full capacity on the Google Meet platform, I will request all of you who are unable to join, please use the YouTube link. With this, now we begin our sessions of the webinar. I would like to invite Ms. Lewis Murray to introduce the eminent speaker, Dr. Atul Kochar. Ms. Lewis Murray, please.
Good morning, everyone. Nurses are the pillars of quality healthcare, and there is a huge need for nursing leadership in quality assurance. To throw light on the topic of quality assurance in healthcare and how nurses can be a voice to lead.
Good morning, all of you.
We have Dr. Atul Mohan Kochar, who is currently the CEO of National Accreditation Board of Hospitals and Healthcare Providers, popularly known as NABH. He has a medical background with MD in dermatology from Delhi University, where he was awarded the University Gold Medal for excellence in the field of dermatology. He is also a diplomate of National Board and a member of the National Academy of Medical Sciences and a fellow of the American Academy of Dermatology. Sir is the recipient of various state and national awards, including the prestigious Sardari Lal Memorial Award for the year 2015. He is the current president, Society for Pediatric Dermatology, and founder secretary, Scientific Cosmetological Society. He has more than 70 publications, 4 books, and many chapters in multimedia to his credit. Sir is an active practicing clinician with a passion for quality in healthcare. Promotion of patient safety, quality, and taking best healthcare practices to the last line are the mission of his life. It gives me immense pleasure to welcome Sir for this talk. I'm sure we are all looking forward to his lecture. Over to you, sir. Dr. Atul, are you there?
Yeah, he is there. His mic is also on. You have 1 minute. You have to mute him. Unmute him. We have to pin him. He will come live. Just unmute him. His mic is muted. No, he is unmuted. The screen. Now it is on.
Hello, Dr. Atul? We are not able to hear you.
Yes.
Sir, you can begin your lecture. I'm unmuted, that's why I'm...
No, here you on.
Savita, the mic is mute. We can't hear anything. We cannot hear anything after.
Okay, sorry, this Microsoft. Hello, am I audible now?
Yeah, now you are audible.
Thank you so
After
much.
my presentation, we couldn't hear anything.
Sorry, there was a technical glitch from our side. Sorry, I will introduce Dr. Atul Kochar again. Dr. Atul Mohan Kochar is going to take the next session, which is on quality assurance in healthcare and how nurses can be a voice to lead. Let me introduce Sir He has obtained his MBBS and MD dermatology from the prestigious Delhi University, where he was awarded the University Course Medal for Excellence in the field of dermatology, venereology, and labrology. Sir is also a diplomat of National Board and a member of the National Academy of Medical Sciences and a fellow of the American Academy of Dermatology. Sir is the recipient of various state and national awards, including the prestigious Sardari Lal Memorial Award for the year 2015. He is the current president of the Society of Pediatric Dermatology and founder secretary, Scientific Cosmetological Society. Sir has more than 70 publications, 4 books, and many chapters in multimedia to his credit. He is an active practicing clinician with a passion for quality in healthcare. Promotion of patient safety, quality, and taking best healthcare practices to the last in the line are the mission in his life. It gives me immense pleasure to welcome such an expert in his field for this lecture, and I'm sure all of us are looking forward to listen to him. So over to you, sir.
Thank you so much, Savita ji. Thank you so much, College of Nursing AIIMS. Thank you so much, Dr. Lata, madam, for inviting me here. I do not have a formal presentation, but what I speak from the heart. And please allow me to speak for 15 minutes, not more than that. And I'm immensely grateful, actually, that you invited me, that you considered me worthy to be here amongst you on this very, very auspicious day. So let me first salute you, all of you. Let me congratulate you and let me wish you a very, very happy Nurses Day. And let me join the nation and the world in saluting all that you have been doing. It's no secret, actually. So every previous speaker, your dean, Dr. Valeria, Dr. Nantini, they all have very beautifully outlined that our nursing officers are the linchpin. They are the fulcrum around which every healthcare organization moves. And unless we empower them, or till we empower them, no further progress in any healthcare sphere is possible. So this is no secret. All have been said, and these are the moments when a madness is raging outside, when there's a mayhem on the roads. Our nursing officers, despite everything, despite all the challenges of infra, despite all the constraints of patient load, and despite their own families and their emotions, they work hands-on. I mean, I had the good fortune of working at AIIMS also in 1992 CN Center, neurosurgery under Dr. Banerjee. And I know that not only AIIMS, but worldwide, I mean, everywhere our nursing officers, I belong to Maulana Azad and I've been a practicing clinician at Lok Naik Hospital. Whether it's Lok Naik or Safdarjung or AIIMS, all nursing officers, they teach everybody, they work with everybody, and they carry on the flag high of dedication and service. This was the first venture, I mean, the topic for today, the quality assurance. So very importantly, please allow me to take 2 minutes to introduce NABH also. So I'm sure all of us are familiar with the National Accreditation Board for Quality for Hospitals and Healthcare Providers. We are one of the constituent boards under Quality Council of India. The other boards are NABL, which looks after the lab. Then there is a NABET for education and training. We have NABCP. But NABH takes care of all the hospitals and healthcare providers, whether they are small or big. We started operations in 2005, but over the past 15 years, there's been lots of progress. Today, there are nearly 12,000 hospitals which are partnering with NABH under various programs. We have the Hospital Accreditation Program, which is into 5th edition. We have entry-level certification. We even have a Nursing Excellence Program. So beyond that, so what exactly this means is that there are set protocols to be followed, which cover staff safety, which cover patient safety, and which cover organizational safety, starting from facility management to everything. And all these standards are kind of capsules in the book form, which are freely downloadable from our website. So please visit our website, www.nabh.co. And please download, whether it's AIIMS program or whether it's a hospital accreditation program. There is some wisdom for all of us, but that is not the point of today's discussion. Our only point is how nursing officers are a part of any quality initiative and how they have to be empowered. Until we empower them, we will not make any progress whatsoever. This pandemic, this COVID-19 pandemic has made us realize so many things. One, we have realized that whether there's a formal certificate or not, whether there's a NABH or JCI or whatever you say, whether there's a formal accreditation or not, but any hospital which follows SOPs, any hospital which follows certain laid down criteria for day-to-day working, that has succeeded in adapting and adopting. We have seen over the past year that there have been changing guidance, whether it's treatment protocol or prevention treatment or whatever, there have been changing protocols. So any organization, healthcare organization which was following protocols, whether it's a hand hygiene, basic hand hygiene or communication safety, whatever, they performed better. Any of our staff members who were used to following best quality practices, whether it is donning or doffing of PPE, very important. They could limit their mortality and morbidity. So these things are very important and they have to be ingrained. They have to be kind of adopted in a daily routine. And accreditation and quality assurance offers one such thing. We are very proud of all our assessors and our nursing officer. Dr. Lata herself is a senior nursing assessor with NABH. So NABH has laid down the foundation of quality in India. It does not matter whether AIIMS has a certificate or Loknayak or a subsequent has a certificate or not, but they all are trying to follow the best practices with all the constraints of the manpower and all the constraints of the patient load. So it's very important to have those practices. This is what pandemic has taught us. Another important lesson which this pandemic has made us introspect is that we cannot get away by creating an island of excellence. We cannot have just one beautiful AIIMS or a beautiful private Fortis or Max or Vedanta. We have to take quality to the last man in the line. We have to propagate the essentials, the basic patient safety goals, how to conduct hand hygiene, basic steps. Until we take these steps to the tier 2, tier 3, tier 4, tier 6 cities, till we create a culture of quality, an ecosystem of quality, we are going to be saddened with patient load and we are not going to be able to manage. So we have to create a culture of quality amongst us, basics of communication safety. And we realize that now that patients are also masked, how to identify the right side, of the everything. I mean, how to identify it. So basic tenets, we have to take all these further. And the only way this can dissipate the culture of quality, the ecosystem of quality is by empowering our nursing officers. So this is what this pandemic has taught us. And we must not realize that nursing excellence, and they all are working very, very hard. So we have to really empower them, we have to train them, and we'll be very happy to onboard more nursing officers. In fact, we have regular training program for assessors. We invite you, all our nursing officers, to join NABH in this movement, and let's shoulder to shoulder take this quality movement further. With that, please allow me to congratulate all of you once again. Let me salute all of you once again for all your dedication, your hard work, and your absolute commitment to the cause of patient care. With that, thank you so much. This has been, and I promise you, and I assure you that we look forward to active collaboration of every kind with all our nursing officers to carry on the mission of quality which NABH, a small part, has taken on. So thank you so much once again, all of you.
Thank you very much, sir, for that talk. You spoke from the heart. It was touching more than the slides, direct interaction with all the nurses. Thank you so much. I know you are very busy. In spite of your busy schedule, you have got time to address the nurses of this country. Thank you so much, sir.
It's an honor. Thank you so much, all of you. And warm wishes for a very, very glorious future for all our nursing professionals and officers. Thank you so much.
Thank you, sir, for taking our time from your busy schedule and addressing our nurses. The next session is on translational health research and its application to lead future of nursing. And to deliver this talk, let me introduce a very distinguished academician and an alumni of our institution, Dr. Pramod Kumar Kark. He is the Executive Director of the Translational Health Science and Technology Institute, Hyderabad. He has completed his undergraduate and postgraduate medical degree from King George Medical College, Lucknow, India, and DM in gastroenterology from AIIMS, New Delhi. He had a long, distinguished career at AIIMS, Delhi, as faculty from 1997 to 2018, where he also held the position of Associate Dean Research from 2013 to 2018. He is a fellow of many prestigious associations, including J.C. Bose Fellow, Fellow of National Academy of Science, and Fellow of Indian Academy of Science. Sir is also a recipient of many awards and honors, including the Om Prakash Pasin Award for the year 2017 and Basanti Devi Amir Chand Prize for Excellence in Biomedical Research by the ICMR in 2017. Sir is also an editorial board member of many reputed national and international journals. He is also executive member of numerous committees of national importance, including various AIIMS, ICMR, and many more other committees. Sir has more than 150 research publications to his credit and has edited and authored many books in his field of interest. We are truly honored to have Dr. Pramod Kark with us today. Please join me in welcoming him for his lecture.
Just check whether Star is online, then we can.
Good morning, ladies and gentlemen. First of all, I would like to thank Dr. Lata Venkatesan, Principal of College of Nursing, for having invited me to give this opening lecture on translational health and research on today's webinar. It is indeed my pleasure to be amongst all of you in this virtual meeting and discuss something about translational health research and its application to lead the future of nursing. This picture aptly summarizes the very important role that nursing profession plays in providing quality health care to all patients in the country. And in the current pandemic, we have seen how the nursing profession has come to the fore and supported all around all the health-related activities in the country. And I bring greetings to all of you on this Happy International Nurses Day, May 12, 2021. Now, in addition to providing medical care, why is it important that nursing profession in general should be engaged in meaningfully in research? I'll discuss a little bit about research, why it is important, why should we all be engaged in research, what is translational research, who are the research stakeholders, and in particular, how nursing profession, nurses in general, could potentially augment and enhance the quantity and quality of research in the country. Who are the stakeholders of research? The stakeholders are the government, the scientific institutions, the sponsors of various research projects, which includes funding agencies, industry, researchers, include doctors, scientists, nurses, and research scholars, and consumers. Consumer is the patient. Patient is the one who is ultimately benefited by medical research that we all carry out. Now, why should we engage in research as a society, as a nation? Now, research brings innovation. Research brings new products. Research brings new medication, new drugs, and it benefits all around. For a country, it increases its economy. Your GDP, by and large, depends on natural resources, human resources, and industry. But when you have innovation through research, you bring out new products. When you bring out new products, you become rich. And this wealth is distributed all over the country to benefit a larger section of society. And you have many examples how research and innovation in other fields have brought in a lot of dividends, whether it's Samsung, Apple, Google, Microsoft, all over the world. The same thing happens in medical research. And for mankind, if you talk about various diseases like tuberculosis, diabetes, AIDS, hepatitis, everywhere it is the medical research which has resulted in development of new effective therapy and cure. Today, for example, someone develops AIDS or HIV infection, a young person is expected to live a normal, healthy life if he or she takes the drugs regularly. Hepatitis C virus is an example of medical innovation and excellence. The virus was discovered in 1989, and in 2016, we had such effective drugs within a span of only about 27 years that the disease is now curable. And in near future, the goal is to eliminate viruses, viral hepatitis. We all know that India has had major successes in R&D, particularly in the field of space and defense. An important question often is asked, are we really equipped for research? I would say yes, for sure. In space and defense, we all know the success stories of GSLV Mach 3, Mars mission, our own indigenously developed Tejas fighter aircrafts. So if India can achieve success in other fields of science, we can do the same in medical field. People often ask us, do we have the resources to do it? And I'm sure many of you must have seen this picture that India's first rocket was actually brought on a cycle. So that doesn't prevent you from doing quality research. So frugal innovation is always possible and key to success if your resources are limited. So medical research for sure is important. A question is often asked, what do we mean by translational research? So research is something that is carried out at multiple platforms. You do lab research where you deal with cells, you deal with viruses, you deal with bacteria, you deal with cell lines. And then you do purely clinical research where you go to the hospitals and wards and look at patients and see what is the disease, what's the outcome of the disease. You develop cohort of patients and say, this is the disease, this is the outcome, and this is likely response to treatment. That's purely clinical research. The translational research is you have a research project and then you carry out some publications, you get some grants, you may have promotions and awards, and finally you have a product. So from this research project, you come out with a product. And this product could be a drug or a diagnostic test. And then this could be developed further to be applied at a larger level so that patients can be benefited. So this is the translational approach of a basic science research going on to the clinical side for application. There have been many success stories in medicine. In India, iodine supplementation, it was a result of a large epidemiological research carried out at AIIMS about 4 decades ago. Diarrhea in children has a high mortality, and studies from India have shown that oral rehydration solution improves survival. Many risk factors have been identified, for example, malnutrition, zinc deficiency, and trials with zinc supplementations have shown less mortality. Now we have our own Indian rotavirus vaccine, thanks to the effort of Dr. Bhan, and this is also reducing mortality in India. So there have been many success stories. So it is not just some kind of repetitive research that is being done in India. We have had major research programs which have shaped our policies and also resulted in decrease in mortality in various categories. And you know now, the latest success story is that of COVID vaccine, which is going to benefit hundreds and thousands of patients and reduce mortality significantly. If you look at publications from India, a large number of publications occur every year. AIIMS Delhi, of course, is at the top of the list. And why I'm telling you is this, that all of you who are working in AIIMS, have been passed out from AIIMS, have graduated from AIIMS, or similar other research institutions, you have all the opportunity to get yourself engaged in research. So how does research help stakeholders? And I told you stakeholders, major stakeholders are the government and funding industry. And if you look at it from a country's perspective, when you do good science, it improves health of people, increase health of people because it increase economy, which again feeds with major resources and funding to science. So it's a win-win situation at all the angles. Now coming specifically to the nursing profession and research. So far we know that nurses are not really engaged intimately with medical research. But I tell you, there are many strengths of our nurses. They are very knowledgeable about medical science, as opposed to others who come from the science stream or PhD stream. They lack the medical science knowledge, and nurses have a lot of knowledge about medical science. Nurses understand the disease biology. Nurses understand the disease process. And they also understand and know what is the lacking, what is the lack. What do we lack in terms of effective treatment for a disease? So I think with the background knowledge of science and disease biology and behavior, and also understanding what are the gaps in our knowledge, nurses are well positioned to be engaged in research. There are certain limitations why our nurses are not into research full-time or in a larger proportion. One is that they don't have good training in research methodology. And today research has to be through a proper research methodology courses. They are not given enough opportunities to get themselves involved in research. There is obviously lack of funding opportunity for nurses-led studies. And of course, there is some lack of initiative also on the part of nurses that why should we get into research? Our job is primarily to treat patients and take care of patients. But I tell you, it is very important for the nurses to get into research. And here comes the role of the institutions. The institutions should start mentorship program under the guidance of a clinician for the nurses so that they understand the importance of research, how to get into research. Nurses should be involved and asked to get center trained through research methodology courses. And at AIIMS, I know that we have started many years ago research methodology courses where nurses also participated. And this is something which should be done on a regular basis, periodically, all across the country. The institution should also provide funding for research. And at AIIMS, I know that intramural funding is available to nursing profession also when they come up with their individual research projects. So I think this is something that the institution must do, organize courses, encourage nurses to get into research programs and provide them funding for research projects. Important role for nurses also is there. They must partner with medical researchers, doctors and scientists. They should engage in clinical trials, and they can be very useful in, for example, screening patients, including patients in the trials, workup of those patients, follow-up of these patients, and also data collection and management. All these can be done by nurses in a much better way than non-medical scientists. They should also be principal investigators of research projects. They should start nurse-led interventions. For example, they can do screening for studies. I mean, you can have a screening study in a different population, in a geographically defined population. For example, for diabetes, for hypertension, for viral hepatitis. So many diseases are there. They can also do intervention trials. For example, they can start a study on yoga in post-op recovery. This can be done in a hospital setting. So there are many projects where a nurse can become a principal investigator, nursing officer can become a principal investigator, and along with the medical colleagues, a proper research study can be carried out. In addition to what I said, they can partner with medical researchers and be associated with other kinds of studies. There is, to my mind, a vast untapped potential of nursing profession getting seriously into medical research. They can be very important partners in clinical and translational research. The institution in nursing colleges must prioritize research. They have to enthuse and support nurses for getting trained in research methodology courses, providing them opportunity to get into research, and also give them funding opportunities. And they also must have a defined career path in clinical research for a proportion of nursing officers and nursing students. With this, I thank you very much for giving me this opportunity, and I'll end my talk by saying research is hard, frustrating, time-consuming, and without immediate rewards. But at the end of it, it's a fun and exhilarating exercise. Thank you all very much, and greetings once again on International Nurses Day. Thank you.
Thank you, sir, for motivating us with practical examples on research and innovation such as iodine supplementation, oral rehydration solution for diarrhea, rotavirus vaccine, and lately our very own COVID vaccines, etc. Slowly and steadily, we agree that nurses are also getting involved in research, and thank you for pointing out the huge role that nurses can play in research and how we can encourage and support research in our Nursing Education Institute as well as in the clinical area of research. With that, we will move on to our next session. Before that, I would like to announce that we have reached the maximum limit of participants in the Google Meet platform, and we are very happy and encouraged by the enthusiasm that all of you have shown to join our program today. And I request all of you to join us using the YouTube link. Thank you. Our next session is on nursing informatics. Nursing informatics is a growing field of nursing in India. To deliver our next session on digital education system, a futuristic vision to lead nursing, we have with us Mr. Pavan Kumar Sharma. He is the head of digital education services at SIL Limited India. Mr. Pavan Kumar Sharma has a rich experience of over 24 years in information technology and has worked in various organizations like RailTel, National Institute of Smart Government, American Express, Tata Communications, and Videsh Sanchar Nigam Limited, VSNL. He obtained BE in Electronics and Communication Engineering from Regional Engineering College, Trichy. Sir has a vast experience of information technology, administrative and managerial projects and programmers. Under his leadership, SIL has successfully completed several next-generation smart classroom projects, nationally and internationally. The projects like Early Digital Learning Program in Mauritius have been inaugurated by Honorable President Mr. Ramnath Kovind in 2018. I'm sure Sir is going to share with us from his vast experience, and I heartily welcome Mr. Pavan Kumar to deliver his lecture.
Yeah, thank you, Savita, and good morning to everyone. Is that audible?
Yes, sir, you're audible. And I request the participants to use the chat box to write any queries. We will address them at the end of the lecture. Yes, sir,
Okay,
you can continue.
so can I take the session now?
Yes, sir, yes, sir. Please
Sir,
continue.
your slides,
Your slides are visible.
Okay, so you will take the slides and then I will deliver the session from here. Is that or shall I? Okay, this is fine.
Yes, sir.
Okay, first of all, I thank you, Dr. Lata, for inviting me and giving me an opportunity to speak this day, Nursing Day. And I would like first appreciate and salute the dedicated selfless services of nurses worldwide on this Nursing Day. It's an honor to be a part of this discussion and give you a brief insight how the digital education system will lead the nursing education across the country.
Sir, excuse me, sir. Sorry for interfering. Hello, Pavan sir.
Yes. Yes,
Can you share your slides, sir? Because I think the latest one this is the previous version of the slides.
I will share my latest slide.
Yes, sir. So, no need. Let's share the slide.
Is it okay?
Yes, sir.
Okay. So
You can make it
I think
screen.
we have the,
Slideshow, sir, please.
it is on the slideshow only.
But on the screen it is shown as not on slideshow.
Please make it full screen.
Can you make it full screen, sir?
Is it okay?
Not yet.
Is it okay now?
Sir, it's okay. You can go ahead. It's not on slideshow, but it's all right. You can go ahead. It is visible, sir, but not on slideshow. But still, you can continue, sir.
Dr. Pavan, this is Dr. Ganguly. Hope you remember.
Yes, Dr. Ganguly, I do remember.
Yeah. So, Pavan, I think you have to make it on a presentation mode. It is on a slide mode right now.
I have made it on a presentation mode only, sir. I think.
It's all right, sir. You can start your lecture. It's all right, sir. You can start with your lecture.
Is it
So now it's perfect. Now it's perfect.
Yes, sir.
Carry on, Dr. Pavan. Please carry on.
Okay, thank you very much. And let me start it again. Actually, first of all, I want to appreciate and salute the dedicated and selfless services of nurses on this nursing day. However, I think this topic which has been given to me is very interesting because it's the way how the education will transform into the country and also into the nursing education, which is an important field in future. Now we know that there is no secret. Patients trust nurses more than anyone else. We know that because they understand the unique insight of the patient, their needs, their behaviors, their concerns, and their requirements on a personal touch basis. And this is very important, and this has to be translated to all the people across the country, not only in India and internationally. And how you can do and deliver it is beautifully is through digital education systems. And that's what I think some of the eminent speakers have just informed, that we need to make this education to reach, nursing education to reach to every district and every village level. And that is where the important thing is to understand how digital education system will make it more effective, and how these institutions like AIIMS and other institutions can play an important role in making this whole nursing education to reach to the last mile. Now I'll take my information into the first slide while I'll be covering onto the digital education and nursing. There's an important topic which is being talked about is a new education policy, which is going to make the future ready workforce. I will talk what are the changes which has come in school education, what are the changes which are going to come in higher education, then healthcare education, which is important to you, and how the technology is playing an important role in making this education to the international standards, and what are the various digital tools in nursing education. We know that, people are now used to these computers, people are used to these mobiles, and this whole technology is changing every aspect of our human life. How we work, how we bring changes into our normal day-to-day work is being now driven through digital mode. And this COVID pandemic has also taught us to be more digitally connected. So that's the thing we wanted to say that, and you know that important nursing is the most trusted profession and is the backbone of healthcare industry. And they don't play not only a important role in providing a care, but into the administrative side of healthcare, which is very important, and they connect it to the whole healthcare system. Now I'll just take you directly into the changes that are sweeping changes which are happening into the country. Is digital education policy, which is called NEP 2020. Even after almost 34 years of national education policy, this policy has been released last year, and which is an important draft document and the policy and the guidelines of the country, in which it is important how this India can be transformed into a vibrant and global knowledge superpower, not only into the various streams of education of science, but into the medical stream also. Now, as I said, there are several changes which will come. The policies document is almost taking the course almost in next 10 to 15 years. There will be sweeping changes. It is not that from next year onward these changes will be coming into place, but It is a guidance in terms of what are the key changes which will happen in the school education, in the higher education, and in the healthcare education. Some of these changes are listed in my slide, and I will quickly walk you through this. Now, earlier we had a 12 years of education, which has been now modified from 12 plus 3, because now the foundation stage, which has come from early childhood care education, which is called Anganwadis nowadays. So education will start from that stage. Then we call this 5 years of programming, which is called foundation stage. Then we have 3 years from 4th, 5th, 6th, which is a preparatory stage. Third and 5th, 6th, 7th, 8th onward is called a middle stage, and subsequently it is called secondary education, which will change the curriculum and pedagogy structures of the nation accordingly. There will not be any rigid separation of art and science. You can take the various courses based on your needs, based on your interest levels. The board examination will be a low stakeholders, and students can grade themselves in this education reform. And the most important part is media of instruction, which has been emphasized from till grade 5 has to be in their mother tongue. It is called, however, that is the best way the students can understand and connect with their knowledge. Similar changes which are happening into the higher education. Currently, we find that the institutions are primarily focused on.
Hello?
Yes. Yes, please. Dr. Ganguly.
So sorry, carry on, Pawan.
Okay. Okay, fine. Now there are similar changes which will be applicable to higher education also. We will be having multidisciplinary institutions coming in place. Currently, we see that we have engineering institutions like IIT, we have AIIMS, which is for medical, but what the government has a vision is to bring a culture of multidisciplinary, where a blend of science, medicine, or arts can be taken together into one institution. That's the objective. We will not have a fixed program. People can come at any year and then take a break, because there will be a credit scorecard system which will be into a place, and then you can learn for 2 years, take an advanced diploma, and then complete your degree after a certain period of time, which is a bachelor's degree in 4 years. Similarly, there will be a single regulator in higher education. I think legal and medical has been taken out from this. And basically, NEP recommends to bring basic reforms into this education. Now, this slide is very important, and which is very important from the healthcare perspective. What we are trying to say is that the NEP 2020 reforms in healthcare education is the programs, whether it's a medicine program, it is not fixed into the duration, or it will be designed based on the roles that people will take. So it is not that everybody has to study all the aspects of the medicine. And students will be assessed at regular intervals. And the important change which will be there in the first 2 years of the MBBS course will be designed in a similar common period for all science graduates, after which they can take up their own streams of MBBS, BDS, nursing, or other specialization courses. So the first 2 years will be common for all. There is a provision for other medical disciplines like nursing and dental to get into the lateral entries into MBBS course. The nursing, as you know, that it is a very important, where the quality plays a very crucial role. And I think in the first lecture, the emphasis was given on the quality of nursing education. So there will be an accreditation body which will be created nationally, and that body will definitely look after into the quality of nursing education. So these are the reforms which are coming into the healthcare education. Now back onto the education and technology, which I wanted to bring to your notice to everyone that the technology will be an important thing in spreading the education to the last mile into the villages and the districts. So that's why towards that, a national body will be created, which is called National Education Technology Forum, which is a single body which will create the digital infrastructure and digital content in the country. And they will be doing the education planning in terms of learning, assessment, administration, and regulatory part on bringing all the education tools and services into play. The contents will be created in the regional languages. There will be virtual labs where through IR or other technologies, nurses can see that, okay, what are the experiments in 3D? They can see it directly into their devices and learn from there. The practical aspect will be taken subsequently into the on-job. So that's why there will be a role in which the virtual labs will be created, and then there will be a widespread use for artificial intelligence. We should have analytics. We should know the pattern, and this will be a very important role during this pandemic in terms of to know that which areas having what difficulties and what type of genome which is coming into place. Now I come on to this I think most of the people are aware of it. There is one nation, one digital platform which is already live. It's called SWAM. There is a huge library of content which is already available. And it's a digital platform across the country where we can take the several certification and course programs available free of cost to anybody. And some of the programs have a credit transfer into your PhD also, or in terms of the nursing education, I have to check, which I'm not aware of it. Now, what I foresee the digital tools that will be useful in nursing education. There are people who have spoken about the technology, but some of the critical ways in which what is important is we have a lot of eminent professors, we have a lot of eminent teachers in the country. We have, let's say, we have Dr. Lata who is spearheading the education of nursing in AIIMS, and she has immense knowledge, and she is one of the assets for the country. So how to make her knowledge to reach to the last mile, to the districts and hospitals. So various tools have been created, and these can be used to make the digital education available in this nursing education. So some of them are highlighted in this slide. One is the nursing apps, which can provide the valuable information and resources on the go. Anytime people can access and study that. We can have this teleconferencing, which we are doing right now, where we can take online classes. And these are very helpful during this present pandemic. Most of the education has already moved on to the online way of teaching, and we have seen this successfully running for the last 1 year. It is not, it has come recently, it is there for the last 10 years, but the usage has transformed the way in which we effectively used during this pandemic era. Then we can have the e-libraries, which are available with lot of content, lot of repositories. One of the things which I foresee is going to bring a sweeping change is augmented realities. It will be very helpful in the nursing where they can see how the things are happening and feel it in a real-time manner. That's what we can do from virtual realities and augmented realities. And you must have seen several videos which have been created into the 3D animation, and you feel that you are almost into the operation theater and doing those activities through this augmented realities. And you have several website, postcard videos, and other multimedias that have been developed, which can be used as an online single platform. So I see that nursing education will be using these digital tools over a period of time and transforming this education system, rather than current mode in which everybody has to be there in the classroom and teacher come and through blackboard and chalk system, traditional mode of education. And in the end, I would like to tell you that this national education policy and the digital education system are bringing positive change, will bring positive change into the education. There are 990 universities and 4,000 colleges across the country. However, the richfulness of resources and the eminent people availability is very limited, and their knowledge to be transformed into every student, and this can be done through our digital education systems. So anything is going to bring the critical thinking and problem solving capabilities, and so that student becomes the lifelong learners. And one more aspect which I wanted to bring is the globalization of education. The new national education framework has been prepared in line with Sustainable Development Goals 2013 by UNESCO. And these goals will help us to make our institutions into a global university so that they can impart the knowledge internationally and cross-border courses. These courses which has to be updated, the whole curriculum, the syllabus will be updated in line with the current job market requirements. That's very important, and that's the way the whole thing, because in medicine also and medical stream and healthcare stream, a lot of technology tools have come into place. The nurses have to learn them quickly, adapt themselves to use them so that they can give the better results in the healthcare. And that's why these global universities will bring out new curriculum and syllabus to bring job-oriented courses as per the market needs. And also this globalization of education will transform a credit-based transfer program in which the semester system will go away, and then you can have a knowledge where your scorecard will be valid across the world. And that's the way I foresee the changes which will come in coming years. The policy is a draft, and the digital education system which will be coming in place in next 15 years will bring sweeping change in education system. And this will be also applicable to the nursing education system. Thank you very much. I'm sure I could give an insight into the changes which are happening and how the new education policy 2020 will bring sweeping changes into the education domain and also in nursing education. We are happy to answer any of the questions which audience has so that explain them onto any of the points which they wanted to clarify in this discussion.
Thank you, sir, for your wonderful
Yeah.
talk.
Thank you very much, sir, for highlighting the important aspects of the national education policy. And I think when there are changes in the school education, subsequently we need to bring changes in professional education also. So we need to gear how we are going to change the nursing education, because we need to meet the needs, demands, and the way what the next generation expects from the professional education. So I think this global education concept is very much applicable to nursing, because nurses are found all over the world. Any country if we visit, we will always find an Indian nurse caring for the patient. So this system of global education will definitely strengthen the nursing education. And thank you so much, sir, for briefing us about what is going to happen in the field of education over next decades. Thank you so much, Pawan, sir.
Thank you, Dr. Lata. Thank you very much.
Thank you, ma'am. And I once again thank sir for the wonderful talk on digital nursing. Thank you very much. I once again thank Dr. Pawan Kumar for his wonderful talk. Hello, sorry, there was a technical glitch from our side. Am I audible now?
Yes, you are audible.
Okay, thank you so much. So I once again thank Dr. Pawan Kumar for his wonderful talk on digital nursing and for touching upon the national education policy and how nursing can change using digitalization. We will take 5 minutes break now.
No, audience, you give chance for the audience to speak.
Okay. Is there any question from the audience side?
Or any
We have some time to take questions. Or would you like to comment on the topic? You can unmute yourself.
Sir, you mentioned about nursing apps. Could you please name a few of them?
Thanks, Maju. I think there are a lot of applications which are there in the Play Store. I don't have readily available some of the lists, but I think there are several applications. The country, as a national initiative, we are also bringing out some of the new initiatives into medical by bringing out these apps in line with the global applications. Currently, I don't have any answer readily available to you, but I can check and let you know.
Okay, thank you.
Any other questions from the audience? Bhavna, you are not audible. You can use the chat box to write your question.
So I think if there is no query, I think we can take the break, ma'am, and I think we just wanted to conclude that this new education policy and the digital education around definitely bring a lot of changes.
Did you see any questions in the chat?
I cannot see any other question in the chat box. There was one participant, Ms. Bhavna, who wanted to ask a question, but I think her mic is not very clear. You can use the chat box to ask your question, Bhavna.
Sirabada.
Yes, you are audible now.
Yes, Bhavana, please go ahead. Ask your question. Bhavana, you are audible now. Unmute yourself and speak. No. All right, then I once again thank sir for the very wonderful session, and we will take a 5 minutes break, and we will resume our session at 12 noon.
Thank you everyone. Thank you, Savita.
All right, sir. So I request all of you to please don't log out from the platform. We will resume after 5 minutes. Next week separate.
So we will proceed now. When we look into consumer behavior, the first aspect which we look into is who is my customer. So that is his background, his profession, his profile. Then we look into his problems and complexities in his or her life. This is very, very important because from a marketing perspective, we say that if we can solve any of the problems of a large group of people, we have a business proposition, we have a probability of earning profits, and that is what we look forward to in marketing. Now we look into, can I solve any of those problems? What is my organization's value proposition? This is perhaps one of the most important points when we look into, finally, when we are looking into customer satisfaction, it is from where did we start? Where did we start our planning? Based on that proposition, we move forward. And finally, what is my value proposition as a service provider? So the organization has a particular value proposition. We would like to see what is the value proposition individually which I am doing. What is that which I am bringing on the plate of my organization? That is very, very important. When we look into, so today when we look into nursing, nursing is a service. And if we are treating it as a service, then we need to look into it from the characteristic perspective. First aspect which we look into as the characteristic of a service is intangibility. So we cannot see, we cannot taste, we cannot feel a service. So when we look into intangibility, the biggest challenge for anybody who is a service provider is how to say he or she is effective, he or she is facilitating, or is better than the competitor. And for that, we need to add tangibility to our offerings. What is this tangibility? We'll discuss this a little later. Then we get into perishability. It is very, very important that we sort of look into this fact that our services are perishable. So for instance, if your patient needs a particular service or needs to be put on the ventilator today and it is not available today and the patient is critical, you say, I'll provide it tomorrow. It has got no utility for the patient if the patient is unable to survive it. So the service is required today. And that is what is very, very critical about the service. Next thing is variability. It is only in service where the same service can be packaged, with a little bit of variation, created as different products. So in your case, in your profession, you have got general ward, you have got your private wards, you have got your ICUs, you have got your semi-private wards, and the basic service, which is the treatment, is the same. However, based on the facilities which have been added, these add-ons make it a completely different product with different pricing altogether. And finally, we look into inseparability. So whosoever is the service provider, he cannot be separated in terms of the production of service, and therefore the brand image of the organization depends on the actual service provided. So what is the challenge here? The challenge is you have to perform the best every time, all the time. Now we come on to this, I picked up this model because it applies so beautifully with all of you, because the topic given was patient satisfaction and looking into patient satisfaction. So if I'm looking into patient satisfaction from that perspective, I'll start with a very different example for all of you, ladies and gentlemen. A visit to the theater. So tomorrow, if you want to go to the theater and then you come out and I say, okay, let me survey whether you were satisfied or was there a customer satisfaction from this, then what do? I will very simply talk to you and you will say, okay, the performance was good or bad. But does that only be the variable which will decide your customer satisfaction? No. So what are those? Yes, this will be a dominating factor, that is the performance, that is the core product. But then we are also saying that, okay, was the ticket reservation system easy? Were the facilitating, aspects of the equipment which were there, were they handy for all of you? This is one of the molecules. Then the infrastructure. Now, in this infrastructure, there can be theater building, there can be your washrooms, there can be the other facilities which are there. This can be there. Then comes the food and drinks, so the refreshments and the method of delivery, the waiting time, all this comes. So even if if I have gone to a theater to watch a performance, my my satisfaction will depend upon the atmosphere, the infrastructure, the food and drinks, and all other things. So coming back to your hospital services, it will be the experience I had when I entered, my parking of the vehicle, how the people behaved with me at the entrance, the lobby, the registration, the payment systems, and then how was I dealt when I went to the doctor, the diagnosis, and then the support staff, and blah, blah, blah. So these are all these things are the small, small molecules which will actually contribute to the final satisfaction of the patient. And nursing will be one of the components of the overall satisfaction of the patient. Now we come to the three important pillars for customer satisfaction. If I want to enhance customer satisfaction, if I want to go ahead in that, if I want to be the best in that, these are the three pillars which I need to see. The first is my people. Now the people can be the doctors, the people can be the nursing staff, the people can be the support staff, the people can be anybody out there. It is their competency, it is their knowledge base, it is their cooperation, it is their temperament, it is their training, it is their motivation. All these factors come in very handy when we look into people. And this is the most important. So therefore, we always say for service organizations, it is very, very important to look into the recruitment of correct people, the retention of correct people, grooming and development of the people in the way which is ideally in sync with the goals of the organization. Then comes the process. So I sometimes ask, that how many of you had, gone to a big organization or let's say a bank, and then, what did you like? So everybody looks into the way the file moves. That's the process. Similarly, when you come into a hospital, how do you sort of the waiting time at the desk, the waiting time at the payment counter, the processing, the medicines, the overall how the processes are taken care of in a hospital will be very, very important as a determinant for patient satisfaction. So if I'm looking into the patient, why will the patient get unnerved? The patient gets unnerved when he or she. So my mother was recently in a multi-speciality hospital in Lucknow, and then this is supposedly the best. But then when it comes, so she was in the medical ICU, surgical ICU for 13 days, and then she had a hernia operation, which was a reoccurrence. And then the poor old lady, 75 years old, she kept on yelling, I want water to drink, I want water to drink, but there was no water. She wanted something, the food was of very bad quality. Okay. And she said that, I've been having the same thing, can you provide me some non-veg, because the doctor has allowed. So they said we only have eggs, and that also they'll put one boiled egg as a non-veg component in the lunch or the dinner. So what happens is that there is a huge disbalance between what the brand name is about that hospital and how the services or how the processes are followed. So we gave the feedback, but will it be taken very carefully? Did I get a phone call from the organization that you have rated our food as very bad and things like that? No, because feedbacks are just for taken for the sake of feedback, and that's it. It's thrown into the garbage bin. So if they are done like that, then I lose the respect for that particular hospital. So tomorrow, if I have to go to that hospital, it will not be because I am satisfied, but because I don't find a better substitute, because all are equally bad. Next is physical evidence. When we look into the physical evidence, it is very important that we know what is physical evidence. So friends, what is happening is that does my infrastructure, my accessories, my furniture, my lighting, the cleanliness reflect quality? So this is where, so I've shown you a particular private room, and I've also shown you the interiors of a small hospital where the greenery has been maintained. It adds to the ecology, also it adds to the happiness, it also reflects quality on the part of the service provider. So these are the three aspects of, for any service provider, which goes a long way in determining patient satisfaction or customer satisfaction. So this is one of the models which I wanted to share with all of you. These are the 5 dimensions of service quality. This was developed by Parsuraman, also known as the SERV-PAWN model. And this talks about the 5 basic factors which are the determinants of service quality. They are reliability, assurance, tangibles, empathy, responsiveness. So I told you that I'll discuss a little about tangibles. So whether my service is good or bad, it is an intangible. So to add tangibility, what should I do? I need to sort of work on my infrastructure. I need to work on the communication. I need to work on all these aspects of people, material, material, to talk about quality. That should reflect quality. Coming to number 1, which is reliability. So reliability is something which comes once you sort of fulfill the promise, and that is very, very important. Reliability is something which is very important in today's service, especially in hospital business. Are we performing the promised service with accuracy consistently? Next is assurance. Does my staff have the knowledge, ability, and temperament to convey trust and confidence? Especially in the case of hospitals, you need to know that you may have the knowledge and the ability, but it is of no use if the temperament of the service provider, that is the nursing staff or the doctor or the support staff, is not in sync with the requirements of the patient or the patient family. So I have to have the temperament which conveys trust and confidence to the patient. Empathy. It is very important that we understand the patient's psychology. We understand the patient requirements. Yes, here this is something very, very important. That it has, I understand that you all get the type of patients who are not empathetic about you as human beings. There, you will have to explain it to them that, you also demand the same respect. Just because somebody comes from a political background or is, some big gun, doesn't mean that that person can demean or disrespect you. Now, these are certain things which, so I call it a reverse empathy from a service perspective, because that is what is very important in hospitals like AIIMS, and you will have to ingrain it in the minds of the customer from day one, because that is very important. And yes, I can understand being in a government setup, you cannot do everything which I am saying, but yes, in terms of communication, written, oral, notices, you have to somehow bring it to the knowledge or notice of the customer that you are the best and you deserve the best respect in the field. Responsiveness. Are we willing to help our patient and provide service promptly? Now, this is very important. I have seen in hospitals, till the customer starts shouting or the patient starts shouting, there is no reaction from the staff. And that is what is wrong. Then it has to be the service provider has to be responsive. He has to be proactive and not reactive. This is very important. Now, when we are looking into patient satisfaction, it is very important that if I am looking into the mainstay of the patient servicing, that is the nursing, are the nurses getting 100% what they require? Are there hygiene factors in place? Are they getting the best to perform the best? The answer is no, and that is what we need to dedicate some time, discuss this out. That what is that which is unnerving the nurses? What is that which is disturbing the nurses? What is that which is not allowing them to perform 100%? What is that which is making them burn out? Because that leads, friends, to scarcity of people entering this profession. And when this happens, the problem becomes more critical and acute when we look into overall patient servicing. So we have got long working hours, multiple shifts, very demanding schedules, working over 40 hours a week or maybe more than that in India, because this is the data from US. Second point is physicality, that is the physical hazards the nurses are facing today because of the physically demanding jobs to required to help lift the patients from wheelchair to bed or from bed to bathroom, or they have got a high rate of work-related injuries. One of the most chronic workplace hazards for nurses is back injuries. Then there are the other hazards like the exposure to different germs, infections, and things like that. So we are looking into a sensory overload because of monitoring machines, listening for alarms, pages and sirens. So there are certain alarms which are constantly ringing. So some heartbeat measurements and those sort of oximeters which are constantly giving some beep sounds. Okay, so then exposure to hazardous substances from pushing of wheelchairs and other things, the shoulders, straining backs, and then the lower back pain. So there are a lot of these issues which are happening. Then we have bullying and harassment, and when we look into bullying and harassment, it is not only from patients, it is also from your colleagues, your superiors, from the administration, from the doctors, from everyone. And it is actually eats away big time into the morale of the nurses. And the different research papers are talking big time about this thing. And something needs to be done to study this, look into the magnitude and treat it. Shortage of nurses. And this is something very interesting, technological advances. Today, if I'm looking into the major multi-speciality hospitals, it's a complete place of gizmos, technological advancements, different machines coming every day, new technology coming in every day, and nurses are the people who have to actually operationalize these machines, and therefore they need to know much better about it. And when they need to know much better about it, how can they do it? If until unless they learn it, they unlearn the old and keep learning the new. Now this is quite a big task we are asking. When physically they are completely challenged, they have got so many hazards, and then we say, okay, now friends, there's one additional one. You have to now keep on updating yourself on technology. So these are the challenges. So now I'm coming to the last part. So this is dedicated because today we are celebrating the International Nursing Day because it's the birthday of Florence Nightingale, and then as a token of respect for this great nurse and to all the nursing community, we need to also look into the fact that we cannot have patient satisfaction without nurse satisfaction. And the nurse satisfaction comes from two things. One is the respectability amongst patients. So how can we increase the respectability of the nurses amongst the patients? And number two is self-development and self-satisfaction. So the first aspect I'm addressing to is the respectability amongst the patients. So the first thing is a good listener and a wonderful communicator. And when I'm saying this, please note that as per the research papers are concerned, the patients will not proactively disclose their problems until prodded and persuaded with a lot of patience. You have to develop a conceptual and context-based clarity to engage patients effectively through communication right at the early stage of patient's hospital experience. This is very, very important. You have to understand your patient. You have to know the first name, profession, age, the demographics. Now, once you know that, you create a mental profile of the patient. Yes, you can say, how is this possible when we are getting so many patients? And I know, I understand. But to whatever extent you can do, please do it. It helps you in developing a bond with the patient. It helps you to become more efficient. It helps you to understand the problem. And it also increases your respectability in the eyes of the patient. Number 3 is brand communication. You know, have you ever thought about highlighting the contribution of the nurses, specific nurses, or recognizing the nurse contribution, highlighting on posters, boards, good patient feedback should be displayed. It all develops respect and positivity towards the nurses. This is very, very important. And ladies and gentlemen, this is important from the perspective that today, until and unless you talk about your brand, nobody else does. Until and unless you are ready to buy your brand, no customer will buy your brand. So if you are saying that patient should be satisfied with your service, you have to tell them that so many people have already been satisfied, this has been the contribution. So once this stuff is read by the patients, their family, they feel proud about it, they feel fulfilled, and then that is where the reciprocation of respect happens. So you have to only give promises or assurances which you can keep. Number 5 is practice visualization. But for this, you have to end all judgments. So there are bad people, there are good people, and the world is a mix of both of them. You will always have to keep it that you are attracting the best. So you are treating the best patients, you are working in the best hospital, and always keep on visualizing that you are getting this. You will see your life will be transformed. Your mind is like a magnet. It completely attracts the energies which you are thinking. But then if you have judgments, the reverse will happen. You want to read more about it? Please read these 2 books which I put. One is The Creative Visualization by Shakti Gawai. She is the pioneer in this field. And then the recent ones by Rhonda Bryan, the book called Secret. Now we come to self-development. So if I am looking into self-development, the first thing is you need to attend training programs in this regard. Within your organization, outside your organization. Always update yourself in knowledge. Invest yourself. So I always tell people that 5% of your salary should get into a fund which basically funds your further education, further development, training. So treat yourself like the CEO of your own company and you move ahead in your life learning new things. Then comes to physical fitness. So basically, you have to take care of your legs, you have to take care of your back. So you're standing the whole day, what to do? Have the raised leg exercise. Go. Whenever you go back home or you have time to rest, lie down, raise your legs for 20 minutes. And then you get the best of the results in terms of your digestion, in terms of the blood flow, and also in terms of blood flow to your brain. And you need to take care of your back. And then since there's a lot of stress involved, the breathing exercises, the pranayama exercises are a must for you. And these have to be done daily. So we are not talking about the weekend exercising, my dear friends. We are talking about daily exercising. And please, you will learn to say no. No, do not tolerate any bullying from the first instance. But for this, it is very, very essential that we do not allow, politicization of our own office, and we do not allow any politicking. We nip it at the bud. If there are people of that aptitude, of that particular attitude, please throw them out of the organization. Because these are the people who will be the biggest, sayers to the boss. They will be sitting in the boss's office to give some information, and the heads will have to look into it. That this should not happen. We all are equal. We need to look into positivity. That is very, very important. So we need to look into the fact that this should not happen. And when there are statistics related to this, we need to see that this does not happen. Nurses should maintain a journal where you write about your experiences. Whatever time you get, keep a small diary. It helps. It helps bigly. So this presentation is with you. You can always look into this. You can see this, and it relieves stress. It helps you. It gives you time to reflect upon yourself. It improves your memory. So what do you do on a daily basis? Just 15 minutes. Write about how did your day go. How do you feel about just 15 minutes, 10 minutes, just write 2 pages. That's it. And then it goes a long way in transforming your way of thinking. So this is it's sort of a writing meditation, and it helps. Develop some leisure pursuits, hobbies, go for vacation, whatever possible. Vacation does not only mean Singapore or Japan or something. It can be just 2 days to some place. It can be a visit to some holy place, whatever. But once in a year, twice in a year, whatever time permits, do go out, move, and this creates a diversion in your life. That is what is very, very important. And until unless you look into this, it will not change. There has to be a shift in your consciousness. Reward yourself. We all think that our job is the worst job. No, you are into a particular profession where you receive blessings from people, get cured. Yes, there can be unwanted people, but then if you have resolved some major cases, do celebrate it. If you want, you can include your family or friends, but do celebrate it. Finally, one thing which is very important is if you have money in your pocket, you are happy. If you do not have money in your bank, you are not. Please remember, develop financial literacy. Start investments, because over a period of time, 10, 15, 20 years, when you have a corpus, you are happy. And you are happy, it gives you mental moral strength. And when you get mental moral strength, your productivity goes up, your positivity goes up, and the patient will definitely receive your energy and be satisfied, be happy with you, be happy with your hospital. So I have given here 3 books. There are many more, which these are from the Indian authors. So you can read these books, and then try to discuss amongst yourselves how to increase your financial literacy. This is very, very important for our own health, because in India there is nothing called a social security. You have to secure your future. You have to secure your old age. So I have given some points here. So you can set your budgets. You can have an emergency fund, and you can try to keep away from big debts. You know how to have a retirement plan. You have to also save for your dreams. What are your dreams? You should save for your dreams and move ahead in your life. Okay? So with this, I come to the end of my talk. Hope you liked it. I thank all of you for the difference you make every single day. And please make a resolution that we need to change ourselves so that we are more happy, we are more satisfied, and at the end of the day, once we are satisfied, we are happy, we'll definitely keep our patients happy. And that is what is very important. Today, on the occasion of International Nursing Day, let's take a resolution that have a happy nurse in our hospital to make a happy patient. So thank you. Thank you again for inviting me. It was great interacting with all of you, and looking forward to interact with you once again.
It was really an interesting session. And first time a non-nursing person has understood the problems, difficulties and contributions of nurses, and you're the first person who are telling that first focus on the nurses so that the patients will be satisfied. That is a different perspective we have got today. And thank you so much, because self-satisfaction is very important. Only if we are happy, we can make others happy. So that's the moral of the story we have gained. I think this formula has to be popularized. Keep the nurses happy so the patients will be happy. Every hospital administrator and the chairmans of the hospitals should listen to this talk so that they will keep the nurses happy. They will provide better working environment, better relaxation, better recognition and rewards, so that in turn it will pay them back with patient satisfaction. Thank you so much.
Thank you so much, Dr. Devashish Dasgupta, for such an enlightening words on marketing molecular model, customer satisfaction pillar, dimension of service quality, and most importantly, on self-satisfaction as key need of the current era. The session is now open for the question answer session. If you have any queries, you can ask.
Hi, this is Ravi. Can I make a comment?
Yes, yes, please go ahead, Mr. Ravi.
Yeah.
Yes, please.
Yeah. So this was a very interesting session by Professor Devashish. In fact, you touched upon, you brought it out very beautifully as to who's the customer and what are his, expectations. And you spoke about the three pillars: people, process, and physical evidence. And these are very critical points from not only the nurse's perspective, but also from, how a patient looks at a nurse. So I myself want to, just share with you, last year during the first wave, I happened to get COVID and I was hospitalized. And that is when I realized that those 8 days of my hospitalization, my closest friend in those 8 days was the two nurses who were in touch with me day in and day out. So I would like to call out the names: Mr. Smith, the male nurse, and Miss Jyoti, who was the female nurse, and both, used to be so friendly with me to give me, boost my morale, because that was very important. The empathy that they have. You touched upon empathy, sir, in your presentation. So these are aspects from a patient perspective, the expectation that we hold from nurse. And I mean, to wear a smile with so many, difficulty and tension, I would say that nursing as a profession is, I mean, it just stands out. And I would like to wish on this platform, on this International Nursing Day, a very, congratulations and best wishes to all the nurses present. Thank you so much for providing me this opportunity to share.
Thank you, Mr. Ravi, for the compliments to the nurses who cared for you.
I think I would like to, second what Mr. Ravi mentioned. Thanks, Professor Devashish. Devashish Da is always very close to me, and he was my mentor also in my IIM Lucknow days. And in fact, I just want to mention that during this COVID period, in the first innings, actually, when my father, who was 88-year-old man, who was in ICU, I think at that time he doesn't know how to operate even a mobile phone also. I think his best friend was the nursing people who were looking after her. And the kind of the satisfactory belongingness, I will use the word belongingness, they have given it to my father. And when my father was released, first time I saw both the nurses, they came down to drop him to my car, and both of them burst into tears. That kind of belongings, and thanks to the entire nursing fraternity. Thanks to entire nursing fraternity. Thanks, Atan.
Thank you so much. I think every person will have to tell something about the nurses, because any human being has to face nurses at least once in their lifetime, either during the childbirth or during their illness or during the old age. That's what I said in my welcome address. The nurses are the integral part of human life. We cannot separate nurses. But unfortunately, it needs more projection, and more of compensation for the services what the nurses are offering. I'm sure in future it will happen. But as Dr. Devashish, thanks for recommending Dr. Devashish, Dr. Shantanu. You have really introduced a wonderful speaker to us, and we will continue to associate with him in future. And he has really understood the intricacies of our profession and presented the solutions how we can move forward. Thank you so much. Any other participants would like to speak? Anyone else would like to speak? Otherwise, we can move on to the next session. We are ahead of schedule actually, because some of the presentations were recorded. We could save a lot of time, and we are ahead of the schedule. If there are no questions, then we can move on to the next session by Dr. Shantanu Ganguly, the Chief Librarian of AIIMS. Mamata will introduce you.
Thanks all for such an motivational comments. We welcome our next speaker, Dr. Shantanu Ganguly, Chief Librarian, AIIMS New Delhi, to put a light on Digital Health Connect 2021, Novel Approach to Nursing Informatics. Dr. Shantanu Ganguly has 28 years of experience in knowledge management, capability management, change management, resource management, and much more. He is an expertise in data research storytelling. He is also a recipient of national and international awards accolades. He has vast experience of information technology, administration, and much more. We welcome you, sir, here.
Thank you. Thank you for the introduction. I think you have my recordings. You can play that.
Yes.
Good morning, everybody. Myself, Dr. Shantanu Ganguly. I'm the head of B.B. Dixit Library of All India
It is not visible.
in Delhi. At the outset, let me first congratulate and say a happy nursing day to all the esteemed the nursing fraternity, because today is a very, very auspicious day when we celebrate the great person, the Florence Nightingale, as a lady with a lamp.
Kavita ji, you have to put it on display mode. It is not there.
Interesting area, which is called as Digital Health Connect, a novel approach to nursing informatics. Now, some of the areas which I'm going to. Good morning, everybody. Myself, Dr. Shantanu Ganguly. I'm the head of B.B. Dixit Library of All India Institute of Medical Science of New Delhi. At the outset, let me first congratulate and say a happy nursing day to all the esteemed the nursing fraternity, because today is a very, very auspicious day when we celebrate the great person, the Florence Nightingale, as a lady with a lamp. Today I'm going to discuss on a very interesting area which is called as Digital Health Connect, a novel approach to nursing informatics. Now, some of the areas which I'm going to cover in this particular discussion is what's exactly, I'll give you an overview of what is e-health, a brief overview of digital transformation. I'll also look into the nursing and the e-nursing part of it, the different facets of the nursing informatics, the technology transforming nursing profession, and the career prospects in the nursing informatics. Well, this picture is known to everybody.
Kavita ji, I think there is no sound. Probably you have to replay it.
Is providing.
It has not been replayed in a proper way.
Good morning, everybody. Myself, Dr. Shantanu Ganguly. I'm the head of B.B. Dixit Library of All India Institute of Medical Science of New Delhi.
Yes.
At the outset, let me first congratulate and say a happy nursing day to all the esteemed the nursing fraternity, because today is a very, very auspicious day when we celebrate the great person, the Florence Nightingale, as a lady with a lamp. Today I'm going to discuss on a very interesting area which is called as Digital Health Connect, a novel approach to nursing informatics. Now, some of the areas which I'm going to cover in this particular discussion is what's exactly, I'll give you an overview of what is e-health, a brief overview of digital transformation. I'll also look into the nursing and the e-nursing part of it, the different facets of the nursing informatics, the technology transforming nursing profession, and the career prospects in the nursing informatics. Well, this picture is known to everybody, where you can see the Florence Nightingale. The great lady is providing a humanitarian service to the entire military in the military hospital of Sutari. And this picture says that how the humanity is served by the entire nursing fraternity. How unimaginable it is. Well, still that beautiful relationship is still continuing. And we find quite a good number of, the nursing people, they are helping each and every patient with their ailments. So, a pioneering work which was done by Florence Nightingale, which is on data management and visualizations. And keeping that in view, this particular picture where she was showing the diagram, the causes of the mortality in the army in the East, from 1855 onwards to 1856, where a blue color which shows the number of disease areas and all, and from 1854 to March 85, and this is on an epidemiological data or a primary data which was collected and did the data visualization of it. One of the important things with Florence Nightingale was statistical breakthrough. Florence was also a groundbreaking statistician. When she arrived at Sufai, the number of deaths was not being recorded appropriately. Her use of statistics cut through the rumor and hearsay, while diagrams provide hard evidence in support of her recommendations for reforms in patient care. Through the data analysis, she found that they were more likely to survive if they stayed in the hospitals at the front, which had a 12.5% mortality rate, than if they are transferred to the hospital in Chutari, which had a 37.5% mortality rate. In 1859, in recognition of her pioneering work, she was elected as the first female member of the Royal Society of London. Florence included in one of her books, allowed the multiple data comparison in one diagram. It clearly demonstrated that more soldiers had died in the scrimaria in 1855 to 56 from the disease, shown in blue, than from the wounds shown in the red. So it's a kind of a beautiful data visualization she has done for that. Now let me touch upon what is e-health today. E-health, there's a lot of definitions are there. We talk about e-health, m-health, digital health, telehealth. And according to the WHO definition, the use of information and communication technology in support of health and related issues. When I talk about m-health, it's the use of mobile wireless technologies for the health. Digital health, a broad umbrella term encompassing the e-health, which includes the m-health, as well as emerging areas such as the use of advanced computing, such as big data, genomics and artificial intelligence, and the telehealth. The use of telecommunications and virtual technology to deliver healthcare outside of traditional care facilities. Some of these aspects we are going to see in detail in my subsequent slides. Well, health informatics in today, it is the core of the part. But if we look at this Venn diagram, you will see on one hand you need a computer science, other hand you have the information science, and the third angle is your healthcare. So the core part of it is your health informatics. Well, when we look at the nursing informatics, according to the American Nursing Informatics Association says that this specialty is essential to the delivery of high quality and cost-effective care, and that nurses working in this field are committed to using IT to share the data, the information, the knowledge, and the wisdom in nursing. Nursing informatics plays a vital role in supporting bedside nurses, giving them the tools and the processes they need to best care for patients and improve health in both individuals and broader community. So if I look at the same Venn diagram, and if I look more towards the nursing informatics, today nursing informatics is also once again at the core. You have the cognitive sciences, you have the computer science, you have the nursing sciences, and you have the information science.
So these are the four areas, the vital areas coming together, integrating, and the nursing informatics is formed. When you look at the data, information, knowledge, and wisdom, which is called as a DIKW quadrant, well, the foundation for information is your data. When I talk about the information, it is data plus the context. When I talk about the knowledge, it is information plus the meaning. And the M is the wisdom, the knowledge, the insight, and the action. And the value addition, if you look from data to wisdom, it is increasing. Well, data is observation, discrete, objective facts, figures which are collected. Well, information is interpretation of contextualized, categorized. Knowledge is more connectivity, comparison, consequences. And what is wisdom? It is the actionable intelligence established to reach measurable goals, the wiser decisions. So some of the examples I have used here, where in the data you can see the individual birth certificates are filed. Data are analyzed as the information, with the mother's age, the race, the residence. Then in the knowledge, the comparisons to prenatal care, socioeconomic status, trends, benchmarking, and in the wisdom is the public health programs and services established or revised and the education campaign. So how the DIKW, the from a rise from the data to wisdom has taken place, and it is growing day by day. Some of the key trends in the digital transformation in healthcare we'll look at today. Mobile, the rise of the patient care. People have simply become far more, in the past decade, mobility in the name of the game, and the recent statistics show that more than 50% of web browsing in the world occurs on mobile devices of 2018, to be exact, 52%. The Global Observatory of e-health of the World Health Organization defines mobile health as the medical and public health practice supported by mobile devices such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices. The National Institute of Health, Kawati International Center, AIIMS says use mobile technology as tools and platforms for health research and healthcare delivery. Remote patient monitoring. In fact, in today's pandemic time, I think there are several evidences where remote patient monitoring is playing a very, very pragmatic role into it. Then we have a point of care diagnostics. Like, for example, when the patient is arrival, there used to be a conventional testing, but still it is there. I'm not saying it is not there, but it's still there. But what is POCT? That is the point of care, the testing method which is there. It has reduced the number of steps, and it has added, with the help of the technology, it has added a tremendous value addition and a lot of times the nursing people to get. So there is a complete relationship. If you make a very good comparisons between the conventional system which is there and the current POCT which is available today, they are with the help of the different types of technologies, which we will also discuss in detail now. Another area is medication management. Mobile medication management is an area of expertise. Meds, like for example, Meds 360 is a leading medication management platform that provides organizations and clinicians, including physicians and pharmacists, with a comprehensive view of a patient's medication history. Among Meds 360 many benefits, the ability of clinicians to reduce the medication errors and improve the medication adherence following the patient encounter. So medication management is coming up in a big way. Medical imaging, a large number of a kind of an image atlas is created from the different types of images taken from your NMR or your different types of, imaging facilities which are available in the hospitals or healthcare services. And there is a very deep research is going on based on this imaging which is coming up. And there is a lot of analytical aspects are also involved into medical imaging today. One of the important examples, if I look at the COVID-19, the vaccine doses, which are taken from the Ministry of Health and Family Welfare, the data is playing today is a very, very big role. For example, on the state-wise, where you can see from 16th May to the 1st May 2021, how the COVID-19 vaccine doses were taken out. And this data, which is depicted here, based on what? The enormous amount of data, which is the big data which is collected in the healthcare sector. So today, big data is playing a very big interesting role, and it is helping the doctors, it is helping the policymakers, it is helping the researchers to make different kinds of decision support systems. It is playing a very, very big role.
For example, if I take an example of this entire, this particular Aragya Setu, where the enormous amount of data, where you have the COVID patient, where you can go for your vaccinations, where is your next date, self-assessment test, all this data gets collected. But when we talk about the big data doesn't mean so only the numerical numbers, but even it is textual things also. So there is an entire band of research is taking place as far as the big data is concerned, which is basically get into like text analytics and all those areas is very, very pragmatic area in today's context. Treating the patients with a virtual reality is another important area where there is a lot of medical and healthcare is taking. Wonders of artificial intelligence, where today artificial intelligence and deep learning is playing a very, very pragmatic role, and where a very deep research is taking place as far as the healthcare sector is concerned. So as far as the digital health technologies, and there is a transformation of the future of nurses also taking place. So every nurse is an e-nurse today. Given the widespread of use of digital technology in health and social care, it is vital that nursing staff, from the frontline workers to our leaders, embrace the agenda and play a key role in it, meeting the needs of the profession, patients, and care. Promoting nurse leadership and nurse participation in the design, implementation, and deployment of the digital technologies across health and social care. Digital skills within the nursing workforce. In fact, we will see now what are the new skills which are coming up and the information standards that drive the future of the healthcare. So robotics, cutting down on the monotonous task. The medication management which I was talking about, the disinfection, carrying the medical devices from a place A to A, B, lifting the, the bedridden or the navigating and greeting the patients with related to that task. And many of the tasks which nursing people are doing, so it can expedite those work with the help of robotics. Another robot like Moxie, and even they are taking away the repetitive task which nurses used to do. It picks up supplies from the closet and delivery to the patient rooms. Completely an autonomous work which is done by this. So another area, the number 2, which is the remote communication. The COVID-19 pandemic boosted the telemedicine into mainstream practice. It is an effective tool to reduce the unnecessary hospital visits, reduce the risk of cross-infections, and still provide the clinical care. Leveraging the same technologies, telehealth nursing care, which is employed in both emergency and non-emergency situations. Drawing blood with the technology, there is a very interesting robot called VBot. The first robot phlebotomist uses a combination of infrared light and image analysis to detect a suitable vein and then applies the ultrasound to see if the vessel has sufficient blood flow. But it's still in development, it can correctly identify the best vein with an accuracy of about 83%, comparable to an experienced technician. This means less room for painful errors and less time spent on the procedures. The fourth one is a revolution towards 3D printing. Finger splints, organ models, personalized plaster cast, prosthetic parts, even biomaterials like food, and in the future organs, there are amazing things we can already are in process in 3D printing in healthcare sector. There is a very interesting project I came across while studying several literature called Houdini project of the National Machines, where partners with the healthcare institutes and authorities to print appealing foods of cancer patients or those on the restricted diets. Another company called BioZone prints out the gourmet, looking for seniors who need to eat the pureed meals. So there is a complete revolution on the 3D printing area. The fifth area, which is there, very important, is portable diagnostics. A nurse can follow up a COVID-19 positive patient's vitals with a Viacom CheckMe Pro and listen to the lung sounds with an EcoCore. The data can be sent to a physician to monitor the patient's status remotely and recommend the hospitalization in case of suspicious bleeding. Portable ultrasound devices like the Philips Lumify and the Clarius can further assist nurses in certain critical tasks. Nurses trained in the use of such devices can accurately calculate fluid retention both in the pleural cavities of the lungs and the inferior vena cava of the heart failure patients. Artificial intelligence and deep learning and assessing the risk. There was a tremendous research is taking place in Duke University. Researchers demonstrated such an application of artificial intelligence in nursing sector. For example, in sepsis watch, deep learning algorithm helps assess a patient's risk for developing the sepsis. It automatically alerts the hospital's rapid response team in case of a high-risk patient and guides them through the first 3 hours of care administration. The virtual reality for education. Virtual simulations could support the training phase of nurses. A survey from the Wolterskloof group even found that 65% of nursing education programs adopt the virtual simulations, including the VR. For instance, Robert Morris University developed a VR game allowing nursing students to practice urinary catheter insertion. It's a very interesting model they have developed. Those VR trained students show the same pass rate as students who practiced on the mannequins. And the personalized of technology in medication management, one of the important things we are all very familiar, it's called chatbots, are already integral part of the healthcare system. During the COVID-19 pandemic, several dedicated chatbots were launched for remote risk assessment and are still being used. But these chatbots can further ease the burden on nurses by supplementing some of their tasks. For example, Florence is an electronic personal nurse in the color blue. She can remind patients to take their pills, which might be a handy feature for older patients. So both nursing jobs and these kind of robotics will be there together. Both as nursing care requires refined social skills, a high level of empathy and emotional intelligence. Robots are smart algorithms, so are not likely to fill up the field any time soon. As the demand for nurses rises, there will be parts of the job augmented by the technologies from the chatbots to 3D printing to VR. Nurses could benefit a lot from the technology as it might take their task less cumbersome, more creative, and it might free up some of their time. But no way the nursing jobs are going to be replaced. So how technology is transforming the nursing profession today? We'll just take a quick look on this. Online nursing program is coming up in a big way. As the healthcare landscape is continuously evolving and upgrading technological, the nursing staff must adopt accordingly along with their advancement. Specialized care such as intensive care units, emergency treatments, and recovery rooms require nurses equipped with the highest medical and technical knowledge. Smart bed technology. Smart beds are pretty helpful in keeping up the track of the patient's vitals, movements, and weight. Nurses now do not have to spend much time on the patient's vitals as these smart beds do most of the work for them. The bed is equipped with sensors, software can be connected to monitors. This tracks the patient's health and identify new patterns as treatment progresses. It also helps to save time and effort for the nurses. Smart beds also help in keeping the patient safe from any falls. When patients move, the bed automatically triggers a warning notifying the concerned nurse. The next one is your portable monitors. Due to the challenging nature of the work, nurses have to handle multiple tasks at one time. Healthcare innovations such as portable monitors help nurses check on a patient's vitals. Even if they are at a distance, nurses can be alerted immediately if an emergency occurs. This helps to save the lives of the patient receiving critical care. Portable monitors also reduce the need for paper and related stationery. Not only do these devices make nurses more efficient, but they also help to reduce the fixed cost in healthcare management. And automated IV pumps. Automated IV pumps help to control the medicine dosages and drips administered to patients. It also saves the nurse time and allows them to concentrate one or more critical tasks or simultaneously handle multiple patients. The integrated software systems and medical technology can alter the drip doses without waiting for manual changes. Automated pumps can also reduce the human contact chances of transmitting viral infections via regular injections. So there is a changing role of nursing profession. We will look into some of these things, like informatics nurse specialist, the director of clinical informatics, clinical systems analyst, clinical educator, and chief nursing informatics officer. Informatics nurse specialists, their key duties help the nurse managers analyze and interpret data about patient safety and outcomes, collaborating with the other healthcare workers to identify opportunities for IT to improve the workflows of patient safety, developing IT-related policies and procedures for nurses, and coordinating with the clinical system analysts and others on the nursing informatics team to implement the new technologies. Whereas the director of the clinical informatics, he can train nurses and other healthcare professionals in the use of these health data systems, evaluating existing the data systems and keeping an eye for new technologies that is coming up in the market. Making recommendations to executive about the new technologies and maintaining the compliance with the regulations surrounding the privacy and the different kinds of medical data. Supervising the troubleshooting of errors with an IT data system. Clinical systems analysis, troubleshooting errors and users problems in daily operations, training users on new technology features, implementing and installing new systems to work with the facility existing procedures, and testing the computer network system. And a clinical educator, developing training materials, curriculum, presenting educational training or groups of various sizes, administering the hands-on software training to ensure that end users are prepared to work with the data systems, and ensuring that all training complies with healthcare policies and privacy regulations. Chief Nursing Informatics Officer, identifying the informatics strategies to support the clinical nurses and improve the patient safety, understanding the latest evidence-based research on nursing practices, creating a strong IT-based communication process between nurses and other healthcare workers, serving as a liaison among the healthcare administrators and evaluating the new technologies and staying informed about the health and technology regulations. So this is a website which I came across, which is called as AIIMS. I'm sure all of you, I would urge to all my nursing fraternity to please go through it, and probably for your next jump on a nursing informatics job or something like that, you can find a lot of information, lot of webinars, lot of course materials are available on this particular website. So with that, thank you very much. I hope you have enjoyed this session on nursing informatics. Thank you very much.
Yeah. Thank you so much, Dr. Ganguly. I think it was a very comprehensive presentation, how the role of informatics in nursing and how we have to make use of the data and the technology to help in nursing, especially the artificial intelligence, point of care instruments, and data is generated at every point of care, at every transition points. There are a lot of data available, but we need to really project the data and showcase how much we are contributing towards the healthcare indices of the country. Because of nursing care, how the indices are kept low, that kind of equations and projections have to be done with the support of data. Thank you so much, and it was really an enlightening presentation, and we really appreciate your interest right from the beginning of planning for this webinar, and thank you so much for introducing the speakers, very interesting speakers we had. Thank you so much. Thank you so much. Yeah, the participants, thank you,
Lata. Thank you very much for giving me a chance to, work with you.
Yeah, thank you. Now the floor is open for discussion. Participants, any questions or contributions or any points for discussion, you can speak. Unmute yourselves and you can speak. Yes, Deepika, go ahead.
Good afternoon, ma'am.
Yes.
Ma'am, I have a question that why can't nurses prescribe medicine?
Yeah, prescription of medicines. I do not know whether Dr. Shantanu can answer this question, but I can.
I think Professor Lata, you would be the best person to answer.
Yeah. Actually, in the Western countries now, nurse prescribing is becoming very popular. They need to do a special course on nurse prescribing and learn the intricacies of prescription, because the drugs are going to impact the lives of patients, and we need to be very careful. Of course, we learn pharmacology during our nursing, but prescription has to be linked with the act. There should be regulatory permissions, because in case of any adverse events, then who will address, who will pay the compensation to the patient? Is it the nurse who is prescribing, or is it the hospital, or is it the insurance companies? Who is going to pay for in case of adverse events happening because of prescription of medications? So these are all the factors which needs to be worked out before giving authority to the nurses for prescribing. But in our country, Western countries, they have started giving permission for nurses to prescribe medications. In our country, Ministry of Health has published a list of drugs as standing orders which can be prescribed by us, like vitamins and antipyretics and anticonvulsants in case of emergency. When there is a pregnant eclampsia where a pregnant woman is throwing fits, the administering magnesium sulfate will save her and the fetus. So there are certain drugs which are given permission
for nurses to be used without the doctor's prescription. Those are called standing orders. And if you look at this nurse practitioner course is also empowering nurses to prescribe drugs. But then again, the legal implications, and we have to have a Nursing Practice Act for the country in which we need to include all the direct independent functions, dependent functions, and collaborative functions of nurses. So soon, the future is not very far where it will become a reality for nurses.
And Geetika, in fact, when I mentioned about the medication management that made the platform which is there, basically when the doctors prescribe the medicines and everything, right time giving the right medicine to the patient, the right patient is also an extremely important management area, and where the esteemed nurse fraternity, they play a very pragmatic role in that. And in fact, some of these platforms are basically used extensively for these purposes only, and especially these Net 360-degree apps and all.
Okay, sir. Thank you so much, sir. Thank you so much, ma'am.
Thank you.
Any other
questions? Any other questions from the audience?
Yes, ma'am. I would like to ask a question.
Yeah.
Good afternoon, everyone. Just one thing I want to understand that as Dr. Gandhi has mentioned, there is a post he has very clearly stated, the Chief Nursing Informatics Officer. So, sir, I would like to know you that in Indian education ecosystem, where do you see, the current scenario of such kind of courses in education system, and what is the future of that? Librarian information science professionals are quite capable in their own way, but still at certain places they are asked to have medical qualifications. So I just want to understand that actually. I hope my question is clear.
Well, Poonam, that's a very right question. I think Professor Lata, we had a discussion with Professor Lata on this area, that if we can introduce a course on nursing informatics also. See, there are a couple of things we need to understand as far as the nursing informatics course is concerned, that it is there in the international level also, that one has to have a science background. That is the most important thing. Information science, cognitive science, nursing science, and computer science. These are the 4 areas which has to be integrated in a proper fashion to have a nursing informatics course. So if 4 of these important pillars are not, because there are a lot of things are there. Probably as a scientific students, then only it can be done, otherwise not. General patient care, nursing can, any individual who doesn't have a scientific background cannot do the nursing informatics unless and until, say for example, he has got a mathematical background, like for example, he has done BSc statistics, statistics or math statistics, or probably he has gone for data visualization or data analytics courses, he has done something like that, then only he can go for a nursing informatics course. Then he can have a, otherwise for regular courses, you need to have a science background now, because 4 major pillars are.
Yeah. I have seen some of the universities like John Hopkins and other universities have an exclusive course nursing informatics. Even with MSc nursing informatics, I think in India we need to reach to that level to not only think of only the nurse specialties. Now we need to give equal importance to the technology. Unless we are updated technology, we cannot survive in the next few decades. We need to be technologically savvy. So I think these kind of courses will come. But then Poonam, in MSc nursing, there is one unit on nursing informatics, in part of nursing management. We learn. Yes. Yeah, every hospital is going electronic self-documentation. We need to know how to make documentation in the system, how to do indenting, inventory, everything, interfacing with other departments. It's all going to be based on technology. Face-to-face interactions are going to become very, very less. So I think nurses are adopting when they are on the job, but there are no formal courses which trains them so that the adaptation becomes easy.
when they enter the hospitals. So that kind of preparation is required.
Yes,
Yeah.
Lata. I think, Professor Lata, I think you are very correct. Yes.
Yeah. So, yeah. Thank you so much. I think the discussions are more interesting and we really like the participants speaking up. Any more questions? We can have few more minutes because we were supposed to be conducting it up to 3 o'clock, but now we are finished by 1:15, 1:30 we are completing.
Excuse me, ma'am. Good afternoon.
Yes, Pratinda. Yes, please, go ahead.
Yes, ma'am. I have a small concern, not a doubt. Yes. So because of the so much technology around us, is there a danger that we are going to miss the interaction, direct interaction with the patient, which is most important? Like many times, which I have seen in the ICUs when the patient is sick or something like that. So we just go and see the monitors and the ventilators and other things which are around us, rather than looking into the patient or something like that. So in a time like we may miss the direct interaction, direct touch, that what we cherished long back, like we may be so how to handle both things.
I think at self level we need to draw up a line. What I felt was earlier we required a lot of time to carry out the procedures. Now the technology is helping us to reduce the time invested on direct patient care. I think the rest of the time should be used for interacting with the clients. It is within us, we should not, when we enter into the unit, the primary importance must be for the patients who is a living human being lying on the bed, not to the monitor, not to the, that also we have to look at, but we need to prioritize whom we should look at first, whom we should give importance, that's what even the speakers were saying, that patients will never forget how you make them feel, They may forget what you have spoken, they may forget what you have done for them, but they will never forget how you make them feel. So making them feel important when they are admitted is very, very important. That way nurses need to be conscious. We cannot induce that through a technology or somewhere else. It is nursing course has got psychology. We have mental health nursing, sociology, and we make part of public health nursing home visits. So we understand the patients and their ecosystem better than anyone else. And we spend a lot of time at the bedside. The Maharashtra Deputy Chief Minister said when he was admitted with COVID, he said, I salute the nurses. The doctors have spent 5 minutes, whereas nurses have spent all the time with us, 24 hours, 55 minutes, 23 hours, 55 minutes, I will credit to nurses, he said. So when we have that much of time, we should use it to comfort them, interact with them, and make them feel confident and feel better. That is in our hands. Yes, ma'am.
Yeah, Sister Vasundhara, just to add adhere to what Professor Lata mentioned. See, we have to, I mentioned in my presentation also, there are two major components and there is a very big gap between the two. Nursing is always going to be there because there is your emotional attachment to the patient is always there. Your emotional touch, your emotional, satisfaction, and the emotional, you are getting connected basically. Emotionally connected. Technology is what facilitating the service. Technology is only facilitating the service. Today, one particular sister, a nurse, may be serving 3 patients at a time. So keeping a balance of the different types of medication, different types of treatment, different types of ailments, keeping a balance of that, you need a technology in your hand to, to manage that. But emotionally, you are connected with each and every individual patient. That thing nobody can replace in this world. Whatever technology comes, even somebody can put up a robot there as a human being, then also it will not going to serve the purpose. It will facilitate the purpose, but it is not going to serve. Nursing is such a esteemed profession, such a prestigious and such a dedicated profession that it connects with the patient's emotion. So the social and emotional connectivity and the patient care is the most primary thing in the nursing profession.
Yes. And it is not only in nursing, even at home you see The interactions have become less. Everybody is sitting with their mobile phone, you know. I don't know, my daughter has taught my mother how to play games. Now my mother is 76-year-old. She is addicted to games. You know, she is playing games in the phone up to 10 o'clock. I told, don't strain your eyes. It is not only in nursing, in every aspect, even in the families. Now we are addicted to the technology and the mobile phones, you know.
That is basically the flip side of the coin.
Yes, yes.
The flip side of the coin.
Correct.
Thank you so much, ma'am. We should be very careful when drawing the line because when you're using the technology and human touch, so we should be very careful, ma'am. Thank you so much for everything. Thank you.
Thank you. Thank you.
There is one
Yes.
question in the chat box by Saraswati.
Yes.
Does any hospital in India has initiated the chatbot services for COVID-19? I think she might want to write chat box services for COVID-19.
Yes, I think I have come across one particular hospital. I think it was Medanta who have started, but I need to cross check that.
I think now every hospital has got this telemedicine and doctor on mobile, you know.
Even
So,
the Practo app is a very popular. Practo app is a very popular one.
Yes. And Apollo has, you can chat with the team and they help you to take appointment, to talk to the doctor. And every day there are some health informations which are coming up. Yes.
In fact, in my house, 3 of my patients are COVID patients, and they are constantly into remote monitoring and teleconferencing. They are doing on a day-to-day basis, and discussing with a local doctor regarding the different kinds of development that is taking place because of the COVID-19.
Any other query from anyone else?
Good afternoon, ma'am.
Yes,
Ma'am, I have a doubt. Like, if patient relative asks us to not disclose about carcinoma, any type of carcinoma, and the patient asks us, but like I've read, it's our responsibility to tell patient about disease condition, treatment prognosis. So, what we should do in this condition?
So, Dr. Shantanu, I will answer this question. Yes.
So, please do.
Actually, breaking bad news, usually the treating physician has to do, because the moment somebody is diagnosed as cancer, it is going to definitely upset them emotionally. And breaking bad news is a communication which the physicians in oncology undergo, how to break the bad news, and part of palliative care medicine also. Breaking bad news is an art, I would say. So we need to be very careful. So I think the physician should take up the responsibility to disclose the diagnosis. But in my experience, I have seen sometimes family members will request that don't tell him that he is diagnosed with cancer. He will get depressed. We will manage. Don't tell, they will say. But then every patient has got a biofeedback mechanism, The body gives a biofeedback, what is going within them. So somehow they come to know at the diagnosis, even if we try to hide. That's what in my personal experience I have seen. The body biofeedback will tell them. But then as nurses, we need to wait until the doctor discloses the diagnosis to the patient. And we cannot bypass that system, and we cannot tell the patient that you are diagnosed with cancer. Yes. After the doctor will disclose, then we can provide emotional support. We can stay with them to accept the diagnosis and how to go forward to acquiring to the disease,
Yeah. I completely agree with Professor Lata. Let me just add on to what Professor Lata mentioned. Some of the hospitals, like for example, I have experience, like for example, in Max specialty in Delhi, they have appointed onco specialist, onco psychiatrist specialist they have appointed. So the first communication is done by the onco clinical specialist, psychiatric specialist. He brings that particular thing and he informs the patient in a much more strategic way So that what Professor Lata was mentioning about the biofeedback, that's I mean, the person should be able to succumb that particular shock. That's a very important thing. And there is a way of, I think the psychiatric people or the psychological specialists, they get trained to, communicate with them in that kind of a situations and all. And there's a lot of yardsticks are forwarded for that.
Yes. Thank you. Thank you. Yes.
Any other?
So shall we go for valediction? I think it's going to be lunchtime. And
Thank
Mamata, I think, yes.
Thank you,
Yeah.
Dr. Shantanu
Thank you.
Ganguly and Dr. Lata
Yes.
Venkatesan for clarifying the queries of the participants. Also, we are thankful to Dr. Shantanu Ganguly for introducing us to the health informatics and the nursing informatics. We here have a video message from an ex-faculty of College of Nursing, AIIMS, New Delhi, Dr. Ashia Qureshi. I would like to share it with you all.
Volume is not there, Mamata. Just check.
We are trying.
No volume. You have to replay again.
Salute our frontline heroes and superheroes. Today on Hi everyone. Today on this International Nurses Day, the whole nation salute our frontline heroes and superheroes. We express our appreciation and gratitude for your wholeheartedly selfless services with dedication during this worldwide crisis.
It is not audible.
You are appreciated and loved. Today on Hi everyone. Today on this International Nurses Day, the whole nation salute our frontline heroes and superheroes. We express our appreciation and gratitude for your wholehearted, selfless service with dedication during this worldwide crisis. You are appreciated and is now Hi everyone. Today on this International Nurses Day, the whole nation salute.
Yeah, just unmute the system. The system has to be unmuted. Yeah, system mic you can unmute.
Hi everyone. Today on this International Nurses Day, the whole nation salute our frontline heroes and superheroes. We express our appreciation and gratitude for your wholeheartedly selfless services with dedication during this worldwide pandemic. You are appreciated and loved and supported by millions of people around the globe. You risk your lives every day and ensure people have a fighting chance to live in these extremely tough and dark times. My dear angels, you are our nation's guiding light in the face of this adversity. You are our greatest hero in this titanic story. Your intelligence, bravery, and compassion are the saving grace of the whole globe during this dark epidemic. Thank you for all that you do. You are our real heroes, and we value every single effort to save.
Thank you. And Savita, there is one participant, Mr. John Joseph Prasto. He want to recite a poem for 1 minute. Can we give him a chance? Manju, is that okay? I know you're ready for. Yes. Yeah. John, Joseph, you are there? Yes, Joseph. You can introduce yourself and recite the poem.
Yeah, good afternoon, Dr. Lata Madam, and good afternoon to all the eminent speakers and participants on the floor. I'm Joseph John Crasto, and I'm from Hyderabad, and I'm currently pursuing my second year MSc Nursing from JMJ College of Nursing, Hyderabad, and my specialty is medical surgical nursing with my subspecialty as cardiothoracic nursing. And today, I would like to recite a poem and salute all our nurses for the work that they do and they are doing in this pandemic. So my poem goes like this. Nurses are the warriors, the restless frontline soldiers. Their sacrifice is non-cooperative, but their services to mankind is very, very imperative. They embellish patient care with grace, obeying the call for duty, never retrace. Wrestling with this pandemic is meticulous. Nurses are classically assiduous. Perseverance of nurses, no limit, delivers quality of healthcare every single minute. Conscious of the peril of the pandemic, the profession of nurses never goes ischemic. Nurses are individually diversified, enabling their functions optimized. Enthroned as a backbone of the profession, proclaims to transform future healthcare vision. Salute to our inheritance of Lady with Lamp, facilitating healing as the globe climbs up the ramp. When COVID-19 became pandemic, we all nurses stood and still are standing without any panic. All conditions were placed tragic, but we nurses are working hard without any magic. I wish all the nurses a very happy International Nurses Day, and we all are proud and blessed of our profession, nursing. Thank you so much, ma'am.
Wonderful poem, Joseph. Thank you so much. You must publish this in newspaper or in media.
Thank you.
Very nice. Thank you. Over to Manju for benediction.
Thank you, Joseph, for such a rhythmic poem, understanding the hard work of nurses and speaking it from your heart.
Thank you.
Honorable Chief Guest, Dr. Randeep Guleria, Director, AIIMS, the organizing chairperson, respected Principal Madam, Professor Lata Venkatesan, College of Nursing, our esteemed speakers, dear faculty members, ladies and gentlemen, and dear students. It's my proud privilege to propose a vote of thanks on behalf of College of Nursing on this significant day. I must mention our deep sense of appreciation for our beloved director, Professor Randeep Guleria, for his words of wisdom and continued support for celebrating this International Nurses Day. I want to extend my generous thanks to our organizing chairperson, principal and professor of our College of Nursing, Dr. Lata Venkatesan, for her timely guidance, aptness, and proactive attitude in taking up this event with fervor and zeal. I would like to place my hearty thanks to the messages and wishes from our worthy Dame, Dr. Anita Saxena, Honorable Medical Superintendent Dr. D.K. Sharma, our Chief Nursing Officer, Madam Chandelia, and our beloved and dedicated former principal and in charge, Dr. Sandhya Gupta. I convey my great gratitude to our eminent speaker, Dr. Atul Kochhar, CEO, NABH, for stressing upon the need of empowering nurses of nation for patients' health, safety, especially in this difficult time of pandemic havoc. I also extend my heartfelt thanks to Dr. Pramod Garg, Executive Director, Thirsty, Faridabad, on emphasizing up on taking up the nurse-led research projects as principal investigator and motivating the audience to explore the vast untapped potential among them. I also extend my heartfelt thanks to Dr. Pawan Kumar Sharma for highlighting the digital tools for nurses such as nursing apps, e-library, virtual reality, and augmented reality, two-way audio video conferencing, podcasts, etc. I would also like to thank Dr. Devashish Das Gupta, Professor IIM Lucknow, for illustrating upon ways and methods, and Dr. Shantani ways and methods to enhance patient satisfaction. My deep regard for Dr. Shantanu Ganguly, Chief Librarian, AIIMS, New Delhi, for enlightening us about the vast scope of nurses and novelties in digital world. Finally, I would like to take this opportunity to place on record my hearty thanks to all the faculty members for their enormous cooperation in organizing this event. I'm especially thankful to each of the team leaders who have been like a backbone of the program. A big thanks to our chivalrous and senior-most faculty member and Associate Professor Dr. Deepika Khakha for her support and guidance. I also extend my deep gratitude to Dr. Kamlesh Sharma for her workmanship and calmness whenever approached. I must not forget to mention the untiring efforts of Dr. Shashi Mawar, Dr. Poonam Joshi, Dr. Gopi Chandran, Ms. Aditi Sinha, Ms. Rimpal Sharma, Ms. Siddhi Riju, Dr. Pragya Pathak, Ms. Ujjwal Dahiya, Ms. Cecilia Mary, Ms. Surbala, Ms. Lavis Mori, Ms. Smita Das, Mr. Ajesh TK, Ms. Milan Tilva, Dr. Muthu, Ms. Gayatri Batra, Ms. Kiran Singh Samak, Ms. Suchita, Dr. Philomena Thomas, Ms. Anugha, Ms. Babita Sahu, Ms. Meena Ara, Dr. Seema Sachdeva, Ms. Neelima Raj, Ms. Monica Sabharwal, Mr. Hansaram, Ms. Nan Hollam, Ms. Suman Dawar, Ms. Manta Chaudhary, and Ms. Savita. We could not have made this day successful without their commendable teamwork and support, whether it was technical, logistic, hospitality, or refreshment. I must be thankful to the special contribution of Ms. Milan and Mr. Hansaram to their continued technical support. I'm also grateful to the support of CNET, Set Facility Manager Mr. Susan Barrett, our clerical staff and supporting staff for their technical assistance and support. I'm also highly thankful to the participants attending today's webinar on International Nursing Day, and I must congratulate for all of us that we have got more than 2,000 views on YouTube for this day. Let me also extend my hearty thanks to Dr. Asha Qureshi, our ex-faculty members, for her motivating words on this special day. With this, I congratulate all of us to have this successful day celebrated. Thank you, everybody. Thank you for being with us. Madam, would like to say anything? Madam?
Yeah, thank you, Manju. And on my personal behalf, I thank each and every faculty for making this event a successful and smooth one. Each one of you have contributed and made it highly successful wedding. Thank you all.
Thank you, everybody.
Thank you very much, Lata. Congratulations once again to
Thank
you.
you. Thank you. Thank you so much. Thank you so much. So we will work together and we will have much more associations in future
Certainly, certainly.
on
Lata,
different
certainly.
platforms. Thank you. Thank you.
Just I'll take 1 minute, Professor Lata, with your permission, that
Yes, please.
we are organizing an international webinar series, which is going to be on 15th May from 9:30 onwards. It is one of the renowned speaker from Marinjoy Rehabilitation Hospital and Healthcare Service, Professor Nalini Mahajan. She's a very close friend of mine for the last 2 decades. She is going to deliver a talk, her experience, and especially how, because she's a professor as well as she's the medical director also. So she is going to discuss on her entire case study, that how she has established from a scratch the system and everything, how she has set up and all, what are the challenges and issues were there. So I would request each one of you to please, join the event also if you like most. Thank you.
Please share the link to all of us. We will definitely attend. Thank you.
Sure. Thank you, Lata.
Thank you. Thank you.
Just an information to all the participants, please kindly fill your feedback form to get the e-certificates, and the link is there in the chat box. With this, we call it a day. Thank you once again, everybody.
Thank you.